Good evening. I'd like to call to order the Town of Los Gatos Council meeting for September 16, 2025. We will start with the roll call, please.
Councilmember Isto?
Here.
Councilmember Rennie?
Here.
Councilmember Badami?
Here.
Vice Mayor Moore?
Here.
Mayor Hudes?
Here. Okay, so we have a terrific group here for the Pledge of Allegiance, and so let me just read off their names and then they'll come up. So we have Luke Pucci, Aaron Propp, Cameron Marshall, Louis Chen, Johan Jacob, and Sahil Wagadarakar. And did I get everyone? Okay. So I'm not going to say much about them. They are all part of Troop 2, and they have varied interests in the town and in town government. And we're delighted to have the whole group here tonight. So come on up.
Thank you very much for allowing Troop 2 to do the opening Pledge of Allegiance today. Would the audience please rise as able? Color Guard, attention. Color Guard, advance. Color Guard, honor your colors. Please join me in the Pledge of Allegiance. Right hand over your heart or Scout salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. Color Guard dismissed.
Thank you. And I know that council members would like to shake your hand, so if you don't mind coming around and shaking our hands, that would be terrific. Thank you again. Okay, thank you. Tonight, we will start with a presentation from Santa Clara County and regarding the impact of federal budget cuts to residents. And I understand there's a presentation as well. So come on up, please introduce yourselves, and it's wonderful to see you here again, Mariko. We're very glad to have you here.
Thank you. It's always a pleasure to be here. Good evening, Mayor Hudes, Vice Mayor Moore, council members, and city manager and staff. It's always a delight to be here. For those, let's be formal. My name is Mariko Sayok. I am Chief of Staff to Supervisor Margaret Abikoka. Together, we are very proud to represent the town of Los Gatos. And as she has always said since she's been elected, she sees Los Gatos as her partner to make sure that we protect public safety and social services for our shared constituents. We've had the opportunity to share with many the impacts of the federal budget on the healthcare system in Santa Clara County. I think she has shared that publicly now with the Cities Association as well as with our mayors. And today, my colleague Brian Darrow and I were going to continue the conversation, hopefully answer more questions. And ultimately, what we'd like to do is convey that this is a partnership, and we'd love to have you at the table when we look at how do we solve some of these big problems that are looming. And so we'd like to share a little bit about that, and then ultimately at the very end, convey any of your own thoughts, your feedback back to county leadership as we continue to look at how we solve these problems. Brian.
Thank you. Thank you so much, Mariko. Can folks hear me okay? Great. Well, good evening, Mayor and City Council. I'm Brian Darrow. I'm with the County Executive's Office for the County of Santa Clara, and just wanted to echo the thanks for allowing us time on your agenda tonight to talk through some significant information and give an opportunity to answer questions. I'm here, as was alluded to, I'm here to discuss the impact of the recent federal budget cuts associated with H.R. 1, what they mean for our community and for our county operated healthcare delivery system, and also how the county's trying to respond to those cuts. And I have a clicker, so I think okay, great. So as I'm sure the council is quite aware, H.R. 1, also known as the One Big Beautiful Bill Act, was signed into law by the president on July 4th of this year. The law enacts the largest cuts in the history, the 60-year history of the Medicaid program, which is known as Medi-Cal in California. And it also enacts the largest cuts ever to the Supplemental Nutrition Assistance Program, or SNAP, which is known as CalFresh in California. And Medicaid / Medi-Cal, for folks who may not know, that is a critical safety net health insurance program that provides coverage for low-income individuals, for folks with disabilities, seniors, a lot of children, pregnant women, and other vulnerable communities across the country. Actually, about 1 in 5 Americans rely on Medicaid for their health insurance, and 1 in 2 children. And that's a national number. And then for the SNAP benefits, the food assistance programs, it's about 1 in 4 children, between 1 in 4 and 1 in 5 children that rely on those benefits. So H.R. 1 really does hit individuals who rely on Medi-Cal and CalFresh the hardest, but it really has impacts for everyone. And that's because our county-operated health system is such a critical provider of care to the entire community in Santa Clara County. And I'll say a little bit more about that as I go forward. So just to give you some Santa Clara County numbers, 1 in 4 Santa Clara County residents, it's about 465,000 individuals rely on Medi-Cal for their insurance, and it's 133,000 folks who rely on CalFresh in Santa Clara County. I won't go into all of the changes in H.R. 1. I'm happy to answer any questions related to that if folks want to spend some time on that, but just to summarize, particularly on the Medi-Cal side, there are really 2 ways where some very deep cuts are coming our way. And the first is that H.R. 1 makes very substantial reductions in direct payments to Medicaid providers, so Medi-Cal providers. And that really hits our public hospital system. So the entities that disproportionately serve the Medi-Cal and Medicaid population are getting direct hits. Second is major changes that will that affect eligibility, and those changes will have the effect of pushing folks off of Medi-Cal coverage. And the 2 key changes are instituting work reporting requirements. So you need to have worked 80 hours a month and actually be able to report that, or community service or education can substitute. And then they have doubled the number of the frequency at which you need to renew your coverage. So twice a year now, everyone will need to sort of prove that they still are eligible for the program. So those are the 2 hits. And to break that down, for public hospital counties, the hit is really twofold because of that. So as thousands of our residents lose coverage, those individuals will continue to need care. So they're, obviously not going to be getting care in the same way probably. If they don't have insurance, they'll be getting less preventive care, but will be coming in for more deep end services. And now there is no revenue stream that will be tied to those patients. And then the second way it hits us is what I alluded to before, which is these direct payments that were really direct payments to Medicaid providers that are designed to provide systems compensation for the fact that the base rates for Medi-Cal don't cover the full cost of care. So those are also being frozen and then ratcheted down significantly over time. So those are the two ways that public hospital counties are really hit hard. The CalFresh changes, I can go into if folks want more detail. They are significant, but you'll see in the chart that I get to in a minute, much smaller in magnitude than the healthcare cuts. So collectively, this is a pretty enormous change. Medicaid, again, Medi-Cal in California is the single largest source of federal funding for our county health and hospital system. It's actually the single largest source of federal funding for the whole county, but it's more than half of revenue for all of the health system. So just to put sort of an order of magnitude on it, the county expects more than $1 billion in lost revenue per year in the coming years, and the entire budget for Santa Clara Valley Healthcare, the county-operated health system, is only $4.6 billion. So you can imagine a cut taking more than $1 billion out of a $4.6 billion budget is substantial. It makes substantially difficult impacts to address. This is the slide that really shows a summary of our fiscal impact analysis. So based on HR 1 itself and then the Congressional Budget Office's analysis of what HR 1 would do, we looked at what the impacts would be on our own health system and our county. So that's what you see here. The estimated impact of HR 1, along with some state-related changes, will create an immediate deficit. You see this year for the county, it's about $222 million. And then for next year's budget, that jumps up to $513 million. The following year, it more than doubles to over $1 billion. And you can see in the out years, we're talking about $1.3 billion in healthcare-related cuts, and the blue slice there is the CalFresh-related cuts. I will move on to the next slide. So I wanted to spend a little bit of time sharing why Santa Clara Valley Healthcare, again, your county-operated healthcare system, is so essential for the community. So Santa Clara Valley Healthcare operates 4 hospitals now and 15 major clinics across Santa Clara County, which really serve as the backbone for the local safety net system. What's less well known, I think, is that our county system is really a critical healthcare provider to so many residents across the board. So just to give you a few stats, the county health system provides care for nearly 1 out of 4 Santa Clara County residents now. We operate 2 out of the 3 trauma centers in the county. Stanford is the third, obviously pretty far north. And we handle 80% of the trauma cases originating within the county. Half of all 911 transports are taken to a county hospital. So we did the math. Every 11 minutes, someone is taken through a 911 call, someone is taken by ambulance to a county hospital. And we're also now the largest provider of Medicare hospital services. So Medicare, the program for seniors. Again, I think this is less well known, but the county is really a safety net provider in so many ways. So our seniors really more and more are relying on our county health system. We have some excellent services. We have literally the top-ranked rehabilitation center on the entire West Coast. We have the only burn center in Santa Clara County, and one of only 3 that are a burn and trauma center between LA and the Oregon border. So if something unexpected happens, you know, if to you or your loved one, if there's a car accident, if someone falls off a ladder, if there's a fire, the county health system is really the critical lifeline for so many folks in our community, and that's what's at risk with HR 1. This slide is really here because we've received several questions about whether the county operates 4 hospitals now. Is that sustainable? And sort of how did that come to be? So we wanted to just address that question up front. To be clear, the 3 hospitals that we haven't owned for 149 years, because Santa Clara Valley Medical Center has been with us a long time, the 3 hospitals that were purchased or acquired recently were done so either to prevent hospital closure or to reverse the termination of critical lines of service. So folks may remember in 2019 when the county purchased O'Connor and St. Louis hospitals, those hospitals were in bankruptcy and the county was the only bidder. So those hospitals would have closed. And it was incredibly important to have those 2 hospitals and their beds and their ICU beds online because the pandemic hit the very next year, and folks may remember we were really strapped for hospital beds at that time. In 2025, so this year, the county purchased Regional Medical Center, and that happened after the former operator of that hospital terminated in August of 2024 their level 2 trauma center, their STEMI services, which are specialized in heart attack services, and their comprehensive stroke center. So that change actually had two impacts. It really made it difficult, and timeliness of care for folks who live near a regional medical center became a challenge because those services were reduced. But it also had a major impact on Santa Clara Valley Medical Center, the only remaining trauma center within 15 miles of regional. If you've ever drive kind of during the commute time, that could be a 40-minute distance. And so what we saw at Valley Medical Center was actually from January of 2024 to January of 2025, an 87% increase in trauma cases at Valley Medical Center. In 2024, Santa Clara Valley Medical Center, because of those months that regional was closed, the trauma center was closed, had the highest number of trauma cases in the entire state. So that is an unsustainable level of surge of need. And so when we think about regional, it's really not just the East Side and Milpitas and sort of South County communities that are affected. It has ripple effects throughout the entire West Side, the West Valley cities. It is really a healthcare ecosystem that we're talking about that's at risk. I do want to point out, so by purchasing regional, we reversed those impacts. In April, the trauma center is back, STEMI care is back. So those have been reversed, but obviously we have a new threat with the cuts coming from the federal government. And I do want to point out, if not for H.R. 1, we were well positioned to be able to operate those 4 hospitals sustainably. 88 cents every dollar is to fund our healthcare system comes out of direct revenue from delivering care. So it doesn't come from local taxes, and that rate has been going up over time. So we've actually been improving our ability to be sustainable with our system. Healthcare is certainly the topic of the day, but I did want to note that even though the vast majority of cuts are to the healthcare system, there are other services that are at significant risk because the magnitude of cuts we're talking about really can't be absorbed 100% by the health system because of some of the math I mentioned earlier. I think our budget is poorly understood. We probably need to do a better job of explaining our county budget to folks, but only 21% of the county's budget is actually discretionary dollars. As an extension of the state, we have a lot of programs where the funding is tied to the service, so we can't actually move the money around. And even with that 21%, most of that money needs to go to legally mandated services like the district attorney's office and the public defender and all the other public safety services that we provide. So when you break down the discretionary dollars and also the types of services that rely on Medi-Cal, again, the type of funding that is being cut back so much, you're really talking about healthcare and public safety. So that's mental health services, that's the public safety services I mentioned, sheriff's office, DA, public defender, probation, and it's services like housing supports for unhoused residents. That's where we use our discretionary funding. And so because there's nowhere else to cut, those are the services that are most at risk. I did want to talk about Los Gatos specifically. Los Gatos is by no means immune from these cuts. There obviously are different impacts in different communities. There's much less reliance on Medi-Cal in this community. It's about 1 in 10 residents. And the data, by the way, is for Los Gatos and Montecito. That's the way it was able to be sliced. And there's actually a little bit of data includes Saratoga too, although most of it's just Los Gatos and Montecito. So it's about 1 in 10 residents rely on Medi-Cal for Los Gatos and Montecito. And about, I think it's 750 residents rely on CalFresh. But the most important stat on here is the 95% of Los Gatos and Montecito trauma cases are transported to a county hospital. And that, of course, mostly is VMC. I was checking the numbers. It's not as small a number as I would have thought. It was 137 individuals last year from this community who were transported to a county hospital for a trauma case. About 30% of children from this area who are transported by ambulance for any reason are taken to a county hospital. So if you need to go to a hospital and you're a child, it's about 30% from this community. So just a big takeaway, while it's only 8 or 9% of residents here who rely on our health services as sort of their regular provider, it's really these other types of critical emergency and trauma care that makes our system so critical to this community. I actually looked up to, I think one underappreciated part of our county health system is the need for disaster response and the role that can be played. Then during the pandemic, it was really Santa Clara Valley Healthcare that was, I mean, the public health department did a ton of work, but in terms of the mass testing and vaccination sites, that was our county operated healthcare delivery system. And so you may recall all of the mass vaccination sites that went up. During just calendar year 2021, there was 1.5 million vaccination doses provided by your county health system. And I was looking the numbers up. It was about 40% of Los Gatos residents actually got their COVID vaccination from the county. So what are we doing about these federal cuts? I did want to spend a little bit of time on what we're attempting as a solution, or at least a partial solution. Given the magnitude of the cuts, we can't rely on just one strategy. We need a multitude of strategies. It's going to take a lot of different efforts. Some of them will work, some of them won't, but we have to be trying out everything. So this is sort of the three pillars of our strategy here. First is doing everything we can internally to reduce costs and improve efficiencies within our county organization, and even try to draw down additional fee revenue and other small ways to get additional revenue. Second is really seeking state support, and the third is pursuing local solutions. So I'll talk a little bit more about each, and then I'll be done. So the county's already launched a series of initiatives to increase efficiencies and to control costs, and again, maximize revenue. We have an initiative to try to align better with our Medi-Cal managed care plans locally, which I won't get into, but is a real opportunity for efficiencies and potentially increasing the base rates for Medi-Cal. We have a hiring freeze that we've had in place for a while, knowing that we really have to be strategic. We don't want to be hiring people and then needing to lay them off. We have to be very focused and strategic about the areas where we even could expand. This is just in the last 3 years. We've actually been having to think about this, and so it's only ramped up given what's happened at the federal level. We've actually had to reduce 800 positions in the last 3 years, and that was done largely through hiring freeze and being a very focused attention to the kinds of services that we really had to protect. So a lot of the low-hanging fruit has already been grabbed, but there's no question we have to do more, and we don't have a choice. I mean, there's no way we can fill the gap just with revenue, so we have to look to more efficiencies. The second strategy is really the state. The state is going to play a critical role in implementation of HR 1. Medi-Cal is a state and federal joint program. The cuts coming for CalFresh are really going to depend on the state. They may very well pass those costs along to the county. They could even cut benefits for CalFresh. It's to be determined on that. But what we will be advocating and have been in conversations with the state about is the importance of public hospitals. So public hospitals are disproportionately hit by the cuts from the federal government. And the state really does have a vested interest in the sustainability of public hospitals. Public hospitals make up only 6% of all hospitals in the state, but they make up 50% of all trauma and burn centers, and they train 50% of the doctors. So we think there's a strong argument there. The challenge is the state is facing its own fiscal challenges. So, there's going to be difficulty with this, and it won't be a complete solution, but we do need to rely on the state, and that work is underway. Finally, the last strategy is asking our local community to consider a local revenue option, and this is what the Board of Supervisors voted on at their August 7th board meeting, which was to place a 5/8 cent emergency temporary sales tax up for voter consideration. I wanted to point out the county has very limited options for raising local revenue for services. Unlike charter cities, which have what's called home rule, if you're a charter city, you can enact a local tax that hasn't been prohibited by the state. So as long as the state hasn't said you can't do it, you can, or at least you can pose it to your voters. The county is reverse. Unless the state has affirmatively said we can propose a type of tax, counties are not allowed to propose that type of tax. So that really narrows our options. That is why, the short version is that is why a sales tax is what's being proposed. But I wouldn't say that's an ideal type of tax. I mean, we could talk about this, but that is really the narrow option we have. And then some have asked why 5/8 of a cent. And the answer to that is actually very simple. SB 335, which is a state law that was passed a few years ago, I think it was 2023, grants the county temporary authority to provide voters the option to raise a sales tax outside of the 2% local cap. And the amount that's allowed is 5/8 of a cent. So there's been some confusion on this point. I just wanted to make clear that this measure, Measure A, does not affect the ability of any city or other local jurisdiction within Santa Clara County to propose a sales tax measure to their own residents. Because of the way SB 335 is written, there is a complete carve out from that 2% cap, which is the problem that you start to run up against if different jurisdictions have placed tax measures on the ballot. So there's a complete carve out. Finally, we've received some questions about sales taxes being regressive. I just want to say, while it is true that lower income households spend a higher share of their income on sales taxes than a higher income household, I just want to note that it's also true that the most common expenses and that essential expenses that a household has, rent, groceries, utilities, childcare, those sorts of things, are actually exempt from the sales tax. So I did just want to clarify that one point. And then, of course, lower income households are the most impacted by county budget cuts. That's just a reality. So this is my last slide. Thank you for allowing me the time. I won't read through all of this, but I do want to say our community is facing a true healthcare emergency. It's interestingly, like, sometimes people overstate things, right? It's a common thing in the policy world sometimes, but this is not an overstatement. In fact, this was actually recently litigated. There was a challenge to the Board of Supervisors' authority to place this measure on the ballot, saying that an emergency was declared and the measure was placed on the ballot. That was challenged by petitioners in court. The judge sided with the county, noting that validating that this is a real crisis. So that's already been evaluated. I can certainly talk more about some of the numbers we're facing. I think you can tell the magnitude here. I did want to note again, the really most important point that we're trying to communicate with folks is that everyone's care is at risk, because regardless of the type of insurance you have, if we have overwhelmed emergency departments or closed emergency departments or trauma centers, wait times go up, timeliness of care goes way down, and it really is a risk for everyone's care. So we just wanted to really emphasize that point. And, the perspective we've had at the county is that once H.R. 1 passed this summer, especially after the Senate amendments, which made the cuts much more severe, we knew that we had a storm coming, and it's not coming tomorrow, but it is coming soon. And the extent to which we can survive it really depends on how well we can prepare as a county and a community. And so the strategies that I outlined today, they're not perfect. This is all happening as, it's evolving quickly. All of this was within the last couple of months that these things really got finalized. But those strategies are the county's attempt to be as prepared as we can be for the storm. And with that, I can answer any questions.
Councilmember Rennie.
So forgive me the lead into this question. Being a county employee on time, you can't advocate for this. You can only educate us. And I know if you could advocate, your ask would be for us, not using government resources to, as leaders of Los Gatos, support this measure. For me to do that, I need to understand it a little better. And I get the flow through and the seriousness of it. What I'm having trouble with is the size of the dollars. As it's a curse of being an engineer. When I come up with a result, I go back and I test. Does this result make sense? Is it in the right ballpark, or is there something wrong with my methodology? And not knowing enough, just at the high level here, you tell me, okay, there's $1 trillion in Medicaid cuts, and you seem to be implying that these pink lines are due to Medicaid. $1 trillion is supposed to be over a decade. I realize it doesn't ramp all the way up right away, so maybe I divide $1 trillion by 8, and it's $115 billion a year. When you tell me that the county's going to be losing $1 billion a year, or actually by the fourth year already you're at $1 billion, in 1.15, for example. So you're almost at 1% of the total cuts for the entire country. How can we, as one county in one state of 50, be 1% of the entire cuts in the country. So that's where I'm struggling with. I can't put it in the right ballpark.
Yeah, I love that question. That's a great question. Your brain works like mine. A few answers to that question. I'm trying to do the math on how. So we're a big county for one thing, and you know, about 2 million people, 1.9 million people, and trying to do the math on out of a $340 million person country. I think that's 0.5%, 0.6 maybe, something like that. So less than the number you're talking about. But there's a few reasons why we would be disproportionately cut. One is that we're a very high cost community relative to a lot of the rest of the country. And Medi-Cal base rates actually do account somewhat for that. It's not like the federal poverty level where it's flat across the country. And this was one of the things they actually discussed and did not get into the bill, the HR1, which was per capita caps or some kind of block grant program for Medicaid, which would have actually frozen the base program at a rate that wouldn't climb. Medi-Cal base rates do not cover the full cost of care. However, there is some tie-in to what the cost of care is in a certain area. So that's one reason. The second reason, maybe the biggest reason, is that we are per capita maybe the largest public hospital system in the entire country. We are certainly per capita the largest in California, and a lot of that has to do with purchasing the 3 hospitals I mentioned. Some of that, though, has to do with our success at expanding care after the Affordable Care Act. So a third answer there is I think you know that some of the states did not actually expand the Affordable Care Act. So there's about 40 out of the 50 states. I think there were 10 states that didn't. Not only did we expand, we did a very effective job at enrolling folks in coverage. So we have a lot more, fortunately, we have a lot more folks who are signed up for the program for which they're eligible here. And related to that, we also have been very aggressive and very successful at drawing down those supplemental payments that I was alluding to. So again, the way Medicaid is funded, it's a complex mix of things, but one of the ways is these direct payments to provide the really heavy providers of Medicaid services, and we are one of those. And you can get those payments for a number of reasons, but one of them is quality. And we recognize we need those services, so we've chased after those services very successfully. But that success has now become our vulnerability. So it's all of those things I think are the key factors. And I think the theme is really, I mean, the thing that heartens me is that we are, we're one of the healthiest counties in the state and country as well. So I think, that has to do with a lot of factors, but it is not unrelated to the high quality public healthcare delivery system we have here. And so I think it's proven out to be a very successful model, but that's the model that's now at risk. So that would be, I think it's those factors collectively. It's also true that in the salmon colored chart, it's not 100% Medicaid. There are some other things. There's a couple of minor changes to Medicare. There's some changes to the exchange plans that are part of HR1 that are wrapped in, and there's actually some state healthcare related cuts that are not unrelated to changes at the federal level too. So it's not just from that $1 trillion total, but those are some of the reasons.
Thank you. I think that's a really helpful answer, that we really are close to 1% of it, and I understand why we're close to 1%. Thank you.
Vice Mayor?
Thank you, Mayor. So I appreciate you being here. It's very helpful, very informative. I think, I've already seen the actions from the federal government significantly impacting, people in our community and, of course, around the country. And so feel very fortunate that we have a county that is willing to step up. However, I don't think it's always evident how the cuts that you're talking about are going to impact people that live in somewhere like Los Gatos. We're a relatively affluent community, and like you shared, we don't have a huge percentage of people that rely on our public healthcare system in comparison to Eastside San Jose, for instance. So I wanted to better understand how you're thinking federal funding cuts from HR1 will impact someone like me or a lot of folks in our community who, I rely on Kaiser, a lot of folks in our community are on Anthem Blue Cross, and so we don't use the public healthcare system on a day-to-day or a, necessarily an annual basis.
Yeah, thank you for the question. I think it really comes down to the comments I was making about trauma care and the 95% number, it is really more on the special and very emergent types of services that folks in this community rely on our system for. And I do think the regional example is really important because we actually saw this too when San Jose Medical Center which I think is the last hospital to have closed in our community. I remember when we did some data analysis after San Jose Medical Center closed, the ambulance diversion rate for the surrounding hospitals, which is a metric of how busy the hospitals are, the emergency departments are, because you're turning away an ambulance coming in, it's too full, right? We need to divert the ambulance. Those rates, not surprisingly, when that emergency department closed, went up. And so, we fortunately haven't had another hospital close in this county since then, but you do see those ripple effects. The 87% increase that we saw in trauma care at Valley Medical Center is a great example. And I think, you kind of have to look at it as a healthcare ecosystem, and it's not necessarily, you don't necessarily need to rely on a daily basis or even an annual basis on the county health system. It's sort of like you don't know when you're going to need it, and then when you do need it, you really hope it's there.
Right, that makes sense. Can I ask one follow-up on that?
Sure.
Is that 95% number you referenced, in the presentation, you said 95% of trauma cases transported by ambulance are taken to a county hospital. I think that's a shocking number. I think that's much higher than people would think. In Los Gatos, we have El Camino Hospital, which has a relatively small ER. I think they have about 8 beds. You have Good Sam nearby, and then again, you have Kaiser Santa Clara and some of these other nearby healthcare facilities. Can you talk about the difference in emergency and trauma and some of these other higher acuity cares between what some of the hospitals people in Los Gatos are more used to going to, what the difference is between those hospitals and somewhere like VMC?
Yeah, and this is where I not being a healthcare expert, I can't get into too much detail, but a trauma case, just think if you, a car accident. My in-laws were recently in a car accident and needed to be taken to a trauma center, and it was really, there needed to be a air flight involved, taken down to Natividad and south of here in Salinas, and it's so a very, bad car accident, someone falling, as I mentioned, a very significant fall. You need certain types of specialists that, a trauma center, a level 1 and a level 2 trauma center, the way those get accredited is based on the type of specialists you have available at the ready whenever somebody's going to need them. So it's a much higher level of care than a regular emergency department, and it's ready to really handle those significant types of accidents. It's not gonna, if it's something just, a broken bone, a broken leg, or isn't necessarily going to go to a trauma center. But if you're in a very significant accident, that's when you would rely on that very specified, specific higher level of care, and that's why it's 95%. Now, it's certainly nowhere near that for just a regular emergency department visit, and ambulances obviously take people to the ED all the time, and people drive to the ED. So those are not the numbers for the lower level of need. In terms of emergent care, but for the highest level of need, that's exactly why.
Thank you.
Thank you.
Councilmember Badami.
Thank you. So I had a follow-up question on that because the statistics are actually alarming to me, and I think you threw out a number per year. You got the 95% of trauma cases, but I think you quoted a number that was 100 and something. I think it was just under 200.
Yeah, there were 100. I was checking because sometimes it's like 95%. If it's 19 out of 20, that might not be as meaningful as a bigger number. But yeah, the numerator there was 137 people. So I think it was 137 out of 145 trauma cases that were transported by ambulance from this area last year. So it was 2024. Were taken to a county hospital, mostly VMC.
I don't have my calculator here, but I'm thinking that's maybe 3 a week, and that we have maybe some severe accidents, vehicle accidents happening in Los Gatos that concerns me. Does that sound about right? Because usually I think trauma is usually a car accident, somebody falling. I don't see that quite being as frequent.
Yeah, so these are cases, I talked to our EMS folks about this, and these are cases defined as trauma in the field. So the precise definition, I think I would have to get back to you on how that's exactly defined. But we have, across the community, it's over 9,000 trauma cases a year. And so they're, even though this is a smaller, what is it? I think 36,000 folks or something like that in this area.
Close enough, yeah.
Yeah. So it's, it's not an insignificant need that folks have. And sorry, I did a presentation last week with our Santa Clara Valley Healthcare CEO, who would have been able to tell you exactly the definition of trauma versus a regular ED visit, but you got me. But yeah, but I think that's right.
Thank you.
That's alarming. Thank you.
Councilmember Risto.
Thank you. I think the questions I was going to ask were mostly asked, but the other number that got my attention was 30% of children in general transported by ambulance are taken to a county hospital. And I'm guessing that's because typically adults have a bunch of other things that happen, heart attack or stroke or something where you might go to another hospital, and children are typically transported for traumatic head injury or something more dramatic.
Yeah, and again, this is where I couldn't tell you all the background info on why that number is exactly what it is. But it could, yeah, there's also mental health crises that folks can have. I don't know if that's as common with kids, but there are, like, I'm thinking of the different specialty care types of ED visits. There's burn care, there's psychiatric care. There is STEMI, like you said, heart attack, much less common with kids, stroke. So I think it's more in the injury, physical injury, probably some mental health, and burn, the occasional burn and that sort of a thing. Okay,
thank you. And I mean, I think you've made the case. I mean, for example, if the county's impacted, first of all, it looks like, our two nearest local hospitals don't even have that level of trauma care. And so either those emergency rooms will be overflowing with cases they might not be able to handle, or if we have a reduction in trauma centers, then we're going to have a real issue with people queuing up and not being able to deliver that care. Is that the message?
Yeah, yes, that is the message. And I think, obviously we're trying to do everything conceivable from the county perspective to avoid, the worst types of cuts. And it's just, we have such limited options. But yeah, that is exactly what we fear. And that's why we're trying to get the message out of kind of make sure the community is aware of what we're facing.
Okay, thank you. And then one more thing. The other one that was surprising to me is you said approximately 50% of physician training occurs at county hospitals.
So actually, it's about 25% of the physicians for this community. That was actually the stat for the entire state, that public hospital systems train about 50% of physicians across the state. Now that includes the UCs as well. So they're a key trainer, but our system has residency program. I mean, we have a lot of folks come through, and a lot of the physicians. I guess you could ask your physician. I'm curious, but. Certainly did come through Valley Medical Center in particular, and that's about 25% here.
Thank you.
Thank you, and thank you for the presentation. I think the community benefits by understanding, the actual impacts rather than just the total dollars involved. And I did have one question about the county's response. You mentioned the 3 pillars, and when I look at that, I kind of see reducing costs and increasing revenue as 2 separate items. And so it looks like there's a target of about $330 million on increasing revenue, if that's the only revenue measure that's being taken. Are there targets for reducing cost, seeking state support, and pursuing local solutions? Are there financial targets for that? Because I think that when residents are looking at the decision about the sales tax measure, it's also good to put it in the context. Are we making progress in getting more efficient in our healthcare system, reducing costs. So it seems as though it would be important to have complementary financial targets for all of those other 2.5 areas.
Yeah, that's a great point. We're thinking of it in terms of kind of a third to try to fill the $1 billion+ gap. So, the hope is that we can get a similar, if advocacy with the state can be successful, that it would be fill another third of that gap and then fill a third with efficiencies, cost controls, and cuts, frankly, from we can't avoid cuts from our county organization. That's kind of how we're thinking about it. I mean, I would note that, that the chart that I showed, there are numbers within, the bars. There are numbers in there that are a little bit fuzzier in the sense that we have a little bit of control over them. So the work rule reporting requirements, those projections are based both on what the Congressional Budget Office thinks the cuts will be from that, which are significant, actually the largest cuts from Medicaid, but also based on the experience in the 2 states that implemented that a few years back and how many people lost coverage. That doesn't mean that we couldn't do a better job here at maintaining people with coverage. It would require a lot of outreach and a lot of really effective enrollment strategies. But I guess my point is, we're going to try to, in the areas where we can minimize those revenue reductions, we're obviously going to try to do that. There's other sections of HR 1 that are just cold hard math. They're a formula that says we've frozen these provider payments and now we're ratcheting them down over time at this percentage. We've frozen those directed payments and we're ratcheting them down. So that's part of our strategy too, is really with our Department of Employment and Benefit Services, which handles the eligibility program, trying to make sure we're keeping as many people who are eligible for the program actually enrolled as we possibly can.
Well, I think all of us know that healthcare is very expensive, but we also know that there are substantial inefficiencies in healthcare. And so identifying targets for efficiencies as well as the other 2 categories, my opinion is it would be helpful for the public to understand, that there are financial targets in those categories as well.
Absolutely. And if I could just speak on behalf of the supervisor, in that 3-prong model, one of the things that she is looking at is working with administration to develop those metrics. Specifically, when we talk about increasing cost, the reason why it's together is we don't want to look at increasing costs only by asking taxpayers to pay more. And so she has raised several ideas that has been successful in Mountain View that generates revenue for the county with their land, with their leases, that doesn't necessarily go back to constituents asking for that. So that first area, she's definitely looking at operational efficiencies, working with administration in the next couple of years to develop a plan that looks at what those metrics are, looking at revenue generation that relies more on county assets, and then those second pieces of, I think it was state, there are specific targets. And that's where, frankly, we will be working with all of you to see how we as a team can come together to look towards our advocates and our allies in Santa Clara County as well as at the state. But this is really where we believe we could work together as partners to look at how we can help solve this crisis.
Thank you. And I just want to thank you both. It's very helpful to have both the county executive side as well as our local supervisor's perspective because it's going to take both. So thank you for this, and we look forward to seeing you back here.
No, we really just appreciate having the conversation. And this one opportunity that's come out of all this crisis is actually being able to connect with some of the city leaders. And obviously, we're going to need to all be working closely together, so we appreciate it.
Great, thank you. We have quite a few cards on Measure A, which I would put that into verbal communications, and we will get to that in a few moments. At this point, we would move on to our consent items, and let's see, there are 10 consent items on the agenda. And I don't have any cards for consent. So I'll ask if the council has any questions. We have someone online?
There should be one card on there for item 2.
Okay. Dr. Seuss.
Dr. Seuss here. Again, I like to point out that members of the I commented on this thing. You said member of the public commented on concerns relating to item number 1 and 5 on these minutes, and that was actually Abby Normal. He had this was after Labor Day, and Abby Normal wanted to say, "Are you my mom?" For the also, as a doctor, a clue. Yeah, I think everybody sort of needs to get a clue, especially the police. There is pictures in here of that I'll discuss more on verbal communication. Thank you.
Okay, thank you. I don't have any other cards. Council members have any questions, comments, or motion on the consent items? Councilmember Badami?
I'll make a motion to approve consent items 1 through 10.
Second, and I just had a quick question on number 4.
Go ahead.
Thank you. So on the Oak Grove at Live Oak Manor Park, I think this is a super exciting project for our community. And so I just wanted to I'm happy to authorize this amendment, but I wanted to understand from staff side if they have an idea of how this impacts the overall timeline and if there are any major hangups.
This project is really premised on the ability of the Rotary to collect donations to fund the project. So the timeline is really being driven by the Rotarians.
Okay, thank you.
Okay, thank you. So with that, we have a motion and a second. Any comments? Okay, call the question. All in favor?
Aye.
Okay, none opposed. Passes unanimously. Okay, we now move to verbal communications. And I have one card that's unmarked from Susan Bossi. Is that about verbal communications? It is?
Mr. Mayor?
Yes.
Is there any interest in, we do have a staff request to reschedule item number 14. Is there interest on the part of the council to vote on that request before verbal communications?
Sure, that makes sense. I'll just make a motion to delete that item from this agenda and to reschedule item 14. Councilmember Risto.
I'll second the motion.
Any public comment on that? Don't see any. All in favor?
Aye.
Opposed? None. Passes unanimously. Okay. So let's go back to verbal communications. Susan Bossi, and then Willy Wonka.
Good evening. My name is Susan Bassi. I've been a resident of Los Gatos for 15 years and a resident of Santa Clara County for almost 45 years. And Puppy is with me too. And if you see her on somebody's dating app, we got caught on our way in, and it's fake news that it is that the man taking his dating app photo was the owner of this dog. I've been a resident, I've been a publisher in this area, and I'm an investigative journalist. I've been following the issues that arose in our town beginning, well, with family court. I've been investigating that for over 10 years, and there has been a disproportionate problem for women and immigrants and people of color in Los Gatos going through our family courts. I was very alarmed to get public records to find that family court judge James Towery was doing ride-alongs with our police department. At the time, he was running an underground bar bench media police committee with the police chief and the town attorney. Most recently, I have been following the issues related to some of our more controversial residents and the 2020 and 2024 elections. And I have followed the protests, the rallies, the town's expenditures. And that led to covering a code enforcement hearing involving Ms. Lindley Hogan. And I was surprised to find that a divorce attorney by the name of Jeff Blum was the hearing officer in that case. I then became aware that Mr. Blum started negotiating after that hearing and having oral and written communications with Ms. Hogan about pending litigation involving 2 of our council members and Mr. Lee Faggett of Democracy Tent. I had no idea what Democracy Tent was, and Mr. Faggett filed into the formal record in that proceeding that Democracy Tent was
If I could just stop you for a minute, it's pronounced Fagot.
Okay.
Thank you.
Well, clearly you have a very close relationship with this individual to correct me on the pronunciation of his name. I didn't know what Democracy Tent was as a longtime resident and as a reporter in this area. But I am highly concerned that the town has selected a divorce attorney to run a code enforcement proceeding and that that attorney then engaged in misconduct. I have written to Sydney Whalen, the town attorney, about whether or not she intends to pursue that further. The State Bar has a rule of professional conduct, Rule 8.3, which is the snitch rule, which requires attorneys to report other attorneys to the State Bar when they engage in misconduct. I've done an extensive public records request, and the town has been very complicit and non-compliant with the spirit of the public policy related to California's Public Records Act. I believe that the town is engaging in conduct with its town attorneys, code enforcement, and elected officials that exposes us to vicarious liability and significant lawsuits, which will cost taxpayers a great deal of money. Thank you.
Thank you. I had a question, if you don't mind. Ms. Bassey, you referred to a ride-along. Was that a ride-along with the Los Gatos Monte Sereno Police Department?
It was a public record that was produced by the town, and it was from Family Court Judge James Towery, who is now retired, and he requested to do a ride-along with our police department at the time he was hearing family law cases and domestic violence cases in this town. And that is very disturbing, especially given the outcomes of what we have found related to that firm. Mr. Towery is now retired. Mr. Blum discussed him and said that he had a close relationship with him, and okay. I'm concerned.
And if you could clarify the time frame for this?
The email was sent in 2013, but Judge Towery was a family law judge for over 10 years in this county and handled a number of the most controversial cases, including a Filipino immigrant who was involved in some human trafficking allegations.
And the ride-along that you referenced, was that in 2013 or was that? Okay.
He asked to do the ride-along in 2013. I don't know when it was done. The town has not produced other records related to that. Okay. But there seriously needs to be an investigation about what's going on with our town attorneys and our police department, especially given what happened in the Judge Dancer days regarding the traffic tickets.
Okay, thank you very much. Okay. Next up is Willy Wonka, and then Jeff Suzuki.
Hey, Willy Wonka here. Well, okay, on June 26, 2025, I was denied the ability to rent New Museum Los Gatos for a private event. It was a phone conversation, and it was all the stuff that I've been bringing up over and over and over. On 9/10/25, I attended Planning Commission meeting, spoke on Civil War, handed in some projects, and also spoke on Project 2026, which I'm wearing. On 9/11, I attended the Streets and Transportation Commission, spoke on Lynn Avenue Pathway and 101 East Main. That's the audio, so you guys can look that up. Water meters, I sent you in an email, and you, Mayor, spoke, that stuff can all be settled. Van Lord, I sent you guys in an article on Van Lords, something with Palo Alto and somebody having the same kind of abilities of hearing their calling and stuff like that. Emergency manager hire, September 3rd, I sent you guys in. You had the front page where that, I think the town needs to think heavily on $20 million project for notifying stuff like that. The Ninth Circuit case, I filed, a case for real ID and stuff like that, and I have pictures, and it's going on. I need help from the public. 25-5107 because they say this is vexatious. I'm saying that there's a second shooter in the Trump shooting. That's what's in the clue. It's the whole. I showed you some of this stuff in planning and stuff like that, where the FBI director is getting sued for lawsuit claims that he's firing people out because of Trump. This is a picture of the shooter, which is in the clue, which was in the clue case for the town council won't take it, but I'd like to drop this off to the police department. Here's the Ninth Circuit case again. Okay, thank you.
Okay, Jeff Suzuki, and then Gary Montrezza. And by the way, if I pronounce somebody's name wrong, please correct me because I would like to learn. Thank you.
Good evening, everyone. Before I begin, I'll disclose that I am not speaking in my capacity as a Complete Streets and Transportation Commissioner, but as a resident and the president of the Los Gatos Anti-Racism Coalition. What we just heard is that there are 750 visits to our county hospital system every day, and they account for half of all emergency room visits in the county and run two of three of our trauma centers. With the passage of H.R. 1 by the federal government, our county's healthcare system has been defunded. The 4 hospitals and 15 clinics are now collectively $1 billion short. The presentation just given demonstrates that this is not just a San Jose issue or a Milpitas issue, it is also a Los Gatos issue. In the last 2 years, 500 of our residents were transported for emergency or trauma care at a county hospital, and now I ask, where would these people go if they couldn't access a county hospital? The answer is that they would be transported to other hospitals, and they would be forced to wait longer. If our high-volume emergency rooms close, it might be us who are left to suffer. And if not us, it could be our brothers and sisters, our families who would not be able to receive care on time after a car accident or a stroke. Whether or not they have private insurance or not would not matter very much. The hospital would be treating other patients, patients who would have otherwise been in a county hospital. As for me, I would prefer not to live in a world where we ask ourselves what we could have possibly done. I don't think it is necessary for us to learn a grim lesson from body counts or tales of unmitigated human misery. Therefore, in the interests of the well-being and lives of your constituents, I urge that the Los Gatos Town Council endorse Measure A in any capacity, whether collectively through a resolution, if feasible, or in your individual capacities. Thank you for your time.
Gary Montrezza.
Good evening. I'm Gary Montreza, the CEO for Pathway Society. We've been here in the county for about 60 years. We provide inpatient and outpatient substance use treatment and some mental health for county residents. I'm here to support Measure A, not only in my current position, but also as a resident of Los Gatos. I want to give kudos to Brian and the county staff for trying to represent something that's extremely complicated and quite nuanced. And one example I might want to provide is that we're part of the behavioral health or specialty health system. We're also funded by Drug Medi-Cal and Medi-Cal. Those are directly impacted by these cuts. One way to look at it, and what I'm representing today, is the impacts to the specialty health system when the basic health care is lacking. For example, folks that come into our care inpatient often have a lot of physical and comorbidities as well as mental health comorbidities, and we work in tandem with Santa Clara County and the health system, without which doing substance use treatment and mental health would be almost impossible. So I'm coming to you this evening to kind of draw that connection, and also to consider this, that 80% plus of the behavioral services in this county are provided by nonprofits. Why? We do really good things. We marshal resources, we're quite efficient, and we're just cheaper than the county. I'm sorry, Brian, but that's the case. And we're normally embedded in the communities in which we serve. So that's a real strength that we'd like to preserve. And maybe I'll leave you with one idea as well. A good way to look at a healthy healthcare system and behavioral health system is to consider it such as maybe the power grid. You would want a robust power grid. You would want access to power. You'd want proximity to power when you need it. Similarly with care, you would want proximity and access. So if I'm in somewhere else and I don't have a head injury or a car crash, but maybe I'm on my mountain bike and maybe I'm over here up past Lexington and I go down, I will need help and I will need a trauma center, guaranteed. And that is only provided by the county. So time, proximity, and expertise are super critical. So I hope that helps draw these things together, that we're really a knitted system that is dependent. A lot of dependencies are occurring at the same time. So I hopefully that's helpful. Thank you.
Vice Mayor has a question.
Thank you. Thank you very much for being here. Really appreciate this. And your expertise is something that I was interested in and didn't get a chance to ask about. So behavioral health services have changed significantly over the past 2-3 years. Yes. Cal-AIM being a Medicaid program, it's all sort of intertwined. So how are you anticipating some of the sort of direct impacts that we were just talking about for your work?
Sure. For us, it's flat rates, but there's more efficiencies that have been gleaned through Cal-AIM. It's difficult. There's a saying in this business that collaboration is an unnatural act between non-consenting adults. And so when we're trying to merge community and bureaucracies, that could be very difficult. To answer your question, we're far more integrated than we've ever been, but that's quite difficult to maintain. What we've observed is there's quite a few gaps in the system, so that's where some of the friction comes when we're working together. But what we've all realized is how integral we are to each other. So, for example, if someone is going to come into our treatment center, they may have comorbidities and physical and mental health that are without support from other parts of the system. We can't serve them. They're out of our license and certification. They're out of our scope. Wherein, if we have that support, we can serve them. And just to keep it real, these comorbidities exist all throughout the county. No one's exempt from this. So these are equal opportunity disabilities. And so I'm really here to talk about how this needs to be integrated.
Thank you very much.
Thank you.
Thanks for the work you do.
Thanks.
Thank you.
Thank you.
Christine De La Fuente, and then Kylie Clark.
Hello, my name is Christina Del Fuente. I'm a registered nurse. I specialize in cardiac ICU step-down. I'm here. I am a resident of San Jose City Council District 10, and I'm here to encourage my fellow residents of Santa Clara County to vote yes on A. We have a very short time frame between now and when the mail-in ballots start arriving around October 4, 1 month before special election day. I just want to emphasize the scale of the deadly impact of HR 1. I'm not going to talk about dollar amounts. I'm going to talk about human beings. It's really common that I feel that we all know, or most of us know, people who are on blood pressure medicine, heart rhythm medicine, insulin. They need outpatient dialysis. We know people who use long-term care. These are really common things. If anyone is withdrawn from any of these things, they will not survive for very long. People who live in post-acute long-term care on a ventilator, they can only survive for minutes if they're withdrawn from care. And they're obviously not working. They need the safety net. So, and there's more facilities where these folks live across Santa Clara County than there are Starbucks. So every time we go on the road, we are passing thousands of people who will die if they are withdrawn from care as a direct result to HR 1. We can't save everyone who's going to be withdrawn from care, but we can save many through Measure A. So I encourage my fellow residents of Santa Clara County to please vote yes on A. Failure is not an option. Thank you.
Thank you. Kylie Clark, and then Kathy Mattingly.
Hello, Mayor, Vice Mayor, and Council. I'm Kylie Clark. I'm a resident of Los Gatos, and I'm also the campaign manager for Measure A. So I wanted to be here tonight to bridge the gap between that presentation that you got earlier and this ballot measure. Measure A would generate $330 million a year. It doesn't completely fill the gap, but it is needed to get us through. And I want us to think really seriously about what it looks like if Measure A doesn't pass, and to ask each of you personally to endorse Measure A, and to also ask you as a council to support Measure A. I think the point about how many people go to the county's trauma facilities is a really important one, and I agree, honestly alarming, right? One example that this is completely true. It happened 1 week ago. Someone I know had a massive heart attack and was transported to O'Connor Hospital, where they stayed for 8 or 9 days until they were stable enough to be transferred to Kaiser. So they are on Kaiser, and they went to O'Connor and were there for more than a week before they were ready to be what is truly downgraded to Kaiser services. So the county is providing completely essential services. I think one group that is going to be disproportionately affected is older adults. If you think about if we don't have some of these other facilities, that person who lives in this area and had a heart attack would go to O'Connor, and either O'Connor wouldn't exist, right? And they'd have to go somewhere else, or the wait is longer, and it is an ecosystem. And I really, really feel like we need to see it that way and to have that understanding. We don't have a second shot at this. So we need to have Measure A pass in order to have enough money to fill these gaps to get us through. It is temporary. It's just for 5 years. And to me, it is the really only solution that we have. And we need that clear messaging from people throughout the county, because I think it's really easy to just think, oh, this only matters to people on Medi-Cal, or this only matters to people on the east side, and that's just not true. And I hope that you've seen that tonight. I really want to emphasize how this would affect all of us. For some people, it's life or death. It's people who are on Medi-Cal who will absolutely die if they don't have access to these services. And then for some people, it would be that all of our quality of care is worse, and none of us want worse health care. And so, whatever level we're being affected at, whatever level of wealth we exist at, whatever service we're on, this really is about all of us. And I do encourage you to get behind Measure A. And thank you for hearing us tonight.
Thank you. Kathy Mattingly, and then Allison Brunner.
Good evening. I am Kathy Mattingly. It's my first time here. It's interesting to watch how you proceed and very impressive. And I'm with Los Gatos Anti-Racism Coalition and a longtime justice advocate. So as a longtime justice advocate, I'm very often speaking for a church or within a church context and saying, you know, we need to take care of the least of these. It's really important to our humanity to really care about the people who are most impacted. But what's going on right now, we're all going to be impacted. So what's the best thing to do for the people who are most affected by any kind of cuts and reductions is also the best thing to do for ourselves. Thank you.
Thank you.
Hi, good evening. My name is Allison Brunner, and I serve as the CEO of the Law Foundation of Silicon Valley, which is a local legal aid nonprofit. And I'm also a 25-year resident of Los Gatos. Wearing both hats as a safety net provider and as a constituent, I strongly urge you to endorse Measure A as a council and as community leaders. The measure is a vital step to shield our community from the devastating impact of recent federal Medicaid cuts, which will threaten to strip more than $1 billion each year from the county's healthcare system, as we've learned tonight. The county's robust healthcare system isn't just a provider, it's a lifeline. It serves 1 in 4 residents, operates hospitals and trauma centers, and delivers critical services like mental health and more. The proposed sales tax is a strategic, time-limited tool to keep these services alive. At the Law Foundation, we work every day with thousands of low-income families, children, and seniors who rely on these critical services. Without action, hospital closures and delayed or eliminated care won't be theoretical. They'll be a reality that costs lives. The economic disparities in Silicon Valley are staggering. I don't need to tell you that. But I want to say that I don't want to live in a community where that divide only widens. I want to live in a community where everyone has access to essential healthcare services that they need. This is a moment that demands bold local leadership. I hope that you will step up to protect our neighbors. I know that I am busy talking to my neighbors and my friends here in Los Gatos and around the county to make sure that Los Gatos can ensure that everyone understands what's at stake and supports this measure. Our region cannot thrive if our healthcare and our safety net systems collapse. Let's ensure that no one is left behind. Thank you.
Thank you. Linda Swinberg. And then we have a couple of more speakers, and I'm just going to announce that the topic of e-bikes is not on the agenda for public comment. So we do have some comments about e-bikes. We'll take them during verbal communications. Go ahead, Ms. Swinberg.
Hi, Linda Swinberg. I actually wasn't planning on speaking tonight about this, but I've heard a lot of misinformation, and I actually have a lot of personal experience here, unfortunately, dealing with very high-level emergency need on a stroke patient in particular. And I want to say that the patient was in my family and in 2014 was transported to the closest hospital because that's where he had to go. And that's also a very, very high-level stroke center. And it was one of the first high-level stroke centers in the country. And that was Good Samaritan Hospital. Valley Medical also has a very high-level stroke center. But I just want to correct the record here. We have other high-level stroke centers in the county. And when he got there, they didn't have his insurance information. He got there, luckily, fast enough that they were able to put him on life support as he went through the doors of the operating room, of the emergency room. I mean, literally, it was that fast, only because we live so close. That's one of the reasons why I'm so passionate about the roads and congestion in our community, because he would not have survived with the congestion we have today. But that's another matter. So I just want to say, he went in, they didn't have his insurance information. He was Medicaid pending for like 3 days and got a very high level of service at another hospital. And a lot of the, and then it converted to private pay. And of course, it was private pay the whole way, or not private pay, but paid by private insurance. Valley Medical also receives revenue from private insurance. And I'm hoping that we can move a lot of people who are able to work and volunteer and go to school onto, keep them on Medi-Cal or move them onto private insurance. The other thing that I think has been missing from this entire conversation tonight is that Measure A is not restricted to being used for health care. That needs to be known to the public. It is a general use sales tax. And of course, that's so that they only have to pass it by 51%. If it were restricted to being used for healthcare funding, it would have to be passed by 2/3. We know that. I do appreciate everybody speaking tonight, and the questions that you all asked, I think were incisive and really amazing, and thank you for this opportunity. It was good. Thank you.
Thank you. Okay, so I have Arnav Singhal and then James Na. Okay. Go ahead, James.
Good evening. I'm James, and I'm a senior at Los Gatos High School. And for the past few years, I've been commuting to school via e-bikes. And when I'm just coasting along in the biking lane at around 15, 20 miles an hour, cars streaks by in front of me. I brake as hard as I could, and I end up bumping into them, and I'm able to scrape by with just a minor wrist sprain. But I want you to imagine, what if the speed is doubled? What if it's tripled? That's what we're dealing with here. I'm sure you've all seen kids popping wheelies or zooming down Los Gatos Boulevard, and this issue is only becoming more and more prevalent. And I'm not talking about the well-regulated Class 1 or Class 2 e-bikes. I'm speaking about the Telerias or the Surons. Those are the brand names. More specifically, they're not regulated at all. Many commerce platforms like Alibaba ship them straight to kids' doors, and they have many ways of avoiding regulations, such as equipping non-functional pedals or saying there's a speed limiter but not instructing the user on how to set them. And a normal, well-regulated e-bike has a maximum top speed of around 25 miles per hour and 750 kilowatts of power. Those e-bikes, the Surons and the Telerias, have a max power of up to 3,000 kilowatts, which is 4 times as much, and a top speed of about 60 miles per hour. And that's ignoring how fast its acceleration is. So I believe that it is time that we take action on this growing issue. There are 4 recommendations to remedying this issue. Number 1 is education. Parents need to be aware that those $1,000 bikes are not legal. The act of buying it is not legal. They're just not being regulated well. Number 2, we recommend a registration program. We're actively working with schools like Safe Routes to School and Los Gatos High School, that those bikes that are not purchased from legal bike shops in Los Gatos should be registered and be made clear, work complying with the DMV and the police department, that because they're essentially e-motorcycles, they should comply with regulations of the DMV, and they should not be subjected to the same rules as e-bikes because they present a much larger danger. Number 3 is supporting some state legislature. Marin County recently proposed a bill that renders any 16-year-olds or under not able to operate these bikes. And number 4 is enforcement. The town is able to impose a fine of up to $1,500 for those who are not registered. So as someone who's deeply involved in the school community and the biking community, it's not a matter of when, it's not a matter of if, but when someone will be killed. Thank you.
Thank you very much for your comments. So that's all I have for cards in person. Is there anyone online for verbal communications?
There are no hands raised on Zoom.
Okay, we'll close verbal communications then and move on to item number 11. Thank you all for your participation in this. Go ahead.
Thank you, Mayor. Good evening, Town Council, staff, and members of the public. Before you tonight is a request to modify the Wasona Oaks Plan Development Ordinance 1281 to allow an increase in the maximum floor area ratio and lot coverage specifically for Lot 8. The proposed plan development ordinance modification is exempt from CEQA under Section 15061B3, the common sense exemption. The proposed performance standard 9 would allow an increase in the floor area ratio from 1.01 to 1.22 and lot coverage from 66% to 73.4%, resulting in an additional square footage of 400 square feet. Therefore, the proposed changes are not considered a significant change or effect on the environment. The Town Council adopted the Plan Development Ordinance 1281 in 1975 for 17 single-family lots and 1 common area lot. The original approved plans provide details such as area and building coverage for the subdivision as a whole and not for individual lots. Town records for subject property 130 Wasona Oaks show that in 1999, a minor residential development application was approved to convert attic space to living area, indicating the original approved home was 2 stories and about 1,800 square feet in size. The subject property is just under 2,000 square feet, located in the northern portion of the subdivision. A detached single-family residence of size 2,001 square feet with a 464 square foot garage stands on the property. No development is proposed at this time. Future development proposes increasing the total living area from 2,000 to 2,400 square feet with additions to the second floor and conversion of existing attic space. Planning Commission, at its regular meeting on August 13, discussed the proposal to modify the Plan Development Ordinance 1281 and forwarded a recommendation of approval to the Town Council. The applicant submitted a justification letter for the request and approval correspondence with the Wasona Oaks Homeowner Association and a summary of their public outreach result. As of today, staff has received no public comments regarding this application. Based on the findings presented in the staff report, staff recommends approving the plan development application PD 25-002 and introducing an ordinance of repealing and replacing Plan Development Ordinance 1281. This concludes staff's presentation, and I'm available for questions. Thank you.
Thank you, Ms. Merchant. Are there any questions? Okay, I don't see any, so we will open the public portion. And I don't have any cards, but I think there's someone online. Is that correct?
I don't see the applicant online, and I don't see any hands raised.
Okay. To my knowledge, Su Ling, the architect, was supposed to join the meeting virtually.
There's a design company. Would that be our?
Maybe.
SLC Design?
Yes.
Okay.
Yes. Thank you.
And we do have a presentation, I think, so.
Hello, can you hear me? Hi.
Yes, we can hear you. Thank you.
Okay, good. So I'm just gonna go through the introduction of this project, which the planner has already introduced. But what I'm trying to do is just letting you know what the owner is proposing. So we are presenting a proposed addition to an existing 3-story townhome to accommodate the client's growing family and occasional visits from the owner's parents. So existing conditions, which is the home is 2,001 square feet with 3 bedrooms. And the proposed scope is the addition will increase the home to 2,416 square feet with a total of 4 bedrooms. And so the level 1, so it's a total of 3 stories. Level 1 will have a reconfiguration of the laundry room and add a dumbwaiter. And then level 2 will have to remove the existing deck and rebuild a deck and extend the deck further and add a sunroom, which will be a defersal and extend the existing family room, which will be the addition We've reconfigured inside the kitchen, and we're kind of relocating it as well, and create a new staircase to level 3, which is like an attic area. So we're also reconfiguring the primary bathroom, and that's in the existing space. So level 3 has a mezzanine, which they are using it as an office. They're gonna remove that area and partially convert it into an ensuite bedroom. And that's where the 4th bedroom comes in. So the total overall height do not exceed the existing height. And FAR did increase from 101% to 122%. Lot coverage did increase about 200 square feet more. And the total addition is roughly around 400 square feet. So the project has been carefully designed to respect the existing scale of the townhouse while providing much needed functionality and space for a multi-generational household. And that's it. Yeah. Thank you.
Okay, thank you. Are there any questions from council? Okay, don't see any. So let's go. Are there any other folks who want to comment on public comment?
There are no hands raised on Zoom.
Okay, so we'll close public comment then and go back to any questions for staff on this proposal. Okay. Don't see any. So is there a motion, perhaps? Councilmember Badami.
Thank you, Mayor. I appreciate the deliberations of the Planning Commission and concur on what I consider a very reasonable request that met unanimous support of the Planning Commission. With that, I move to accept the Planning Commission's recommendation, introducing a new ordinance repealing and replacing Plan Development Ordinance 1281 to increase the maximum floor area ratio and lot coverage for properties owned RM512 PD, located at 130 Vasona Oaks Drive.
Councilmember Risto.
Thank you. For the same reasons, I'll be seconding the motion.
Okay, are there any further comments or discussion? Vice Mayor?
Yeah, my only quick comment is I think this is Associate Planner Merchant's first meeting with us, so welcome and thanks for presenting to the council.
Thank you, Vice Mayor. Appreciate it.
Okay, thank you. Don't see any other comments, so I will call a question. All in favor?
Aye. Aye.
Opposed? None. Passes unanimously. Thank you, Ms. Merchant. Okay, we will move to item number 12. And item number 12 is a 4th amendment for business license audit. So I do have one card here. We'll take the staff report first, and then we'll go to public comment. Go ahead, Ms. Angwari.
Thank you very much. Good evening, Mayor and Town Council. I'm just waiting for the presentation. So I might request the clerk to advance for me because it's not working. Thank you. So the item in front of you to the Town Council to authorize the town manager to execute the 4th amendment with HDR companies for continued business license support, business license discovery and compliance audit, transient occupancy audit, and sales and use tax management services, and adopt a resolution to waive late fees penalties for businesses actively undergoing audits. Next slide, please. The town is working with HDR companies since 2022. 2022 that marks the year when the town modernized its business license tax program. HDL is assisting with business license online application and business license insurance and services. The current agreement does not include any audit or delinquency services. One of the budget direction with the 2025-26 direction with the budget was to recover business license and TOT revenue through audit. Next slide, please. Since HDL has the business license database and they are very experienced providing business license audit throughout the state of California, it was natural to the TON to engage with those services with them. So the fourth amendment just extend the contract for June 30th, 2027 and audit the audit services. Next slide, please. In addition, some of the fee, where it comes to delinquency collection or discovery audit, it's based on the first year of the identified fee. So it will be based on the percentages of the fee. But after the first year, that businesses that was discovered during the audit will become the base of the TON tax base. And those are the businesses that the TON are not able to identify. So we don't have those businesses in our database currently. And the contract stipulates we have some fixed fees for the TOT audit and the sales tax analysis. For the next slides, please. Staff also requesting the council to approve the resolution to waive late fee penalty. We are requesting to waive late fee penalties for businesses that identified during the audit operating without a business license, businesses that cooperate fully with the audit, and businesses that pay taxes up to 3 years or the tax within 90 days from the notification. So those are and we would like to provide this late fee penalty waiver for all businesses for 90 days to be fair. Next slide, please. So the amnesty program benefits that promotes fairness and transparency and aligns with the best practices in municipal compliance. Can I have the next slide? Of course, we will have staff anticipate some concern when we go through this audit. There are businesses that are not aware that they need a business license requirement. There can be financial burden for retroactive billing and potential penalties. And there will be anticipate disputes over revenue reporting and business classification. What we anticipate and most common business type that will be identified during the audit: commercial rental properties, home-based businesses, transient businesses. Next slide, please. Staff would like to emphasize that issuance of a business license does not constitute for land use approval. So all businesses are responsible for ensuring they meet the TON's planning, zoning, and permitting requirements. So each business that identified operating without a license and comply with the audit and pay the fee business license tax retroactively within 90 days. After that process is completed, the TON will work with businesses to reach compliance. Next slide, please. Just want to provide a couple of sample examples. What will be the financial burden for the businesses? If someone is providing services in town of Los Gatos, the 3-year cost of the business license without penalty is $400,000. A retail small business where the gross receipt, annual gross receipt is below $50,000. The 3-year business license without penalty is $225. And the retail business that would have over $2 million annual gross receipts, if they wouldn't be licensed, the license fee is $4,095. And this is what every business who is licensed would pay for 3 years. May I have the next slide? As mentioned earlier, each business has to have the planning approval, and we just provided a sample of planning fees that each business is paying who is currently applying for a business license. And those fees are vary from $1,096 for 321. Those are the most common one, the home occupancy permit and the use of occupancy. And of course, the council is aware of the conditional use permit for bigger businesses. Next slide, please. So the town is going to publish clear guidance on the town website, partner with the Chamber of Commerce to amplify outreach, and offer personalized support through HDL to assist businesses with the compliance. Next slide, please. As earlier was mentioned, the town will also engage with HDL companies with the transient occupancy audit. And we currently have 5 hotels, and we haven't conducted those audits for a while, so it's just timely due for all of those. Next slide, please. We have sufficient budget for cover for these services. Staff is going to monitor the covered revenue through business license and the TOT, and we'll report back to council on those results. Next slide, please. So technically just repeating the recommendation, the staff requesting that council authorize the town manager to execute the 4th amendment with HDL and also approve the resolution to waive late fee penalties for businesses undergoing audits. And here with me, I have directors, especially Director Paulson and also HDL representative available via Zoom for answer any questions. Thank you.
Yes, Councilmember Badami.
Thank you. This may be more for the town manager, but I know one of the pages of the presentation addressed publishing clear guidance on the town's website. And we did get a desk item about maybe the feasibility of providing a centralized fee schedule that might give clear guidance to anybody that wants to know what fee might apply to a business license that they might be applying for.
Our intent is to work with HDL to create a frequently asked question documents that can explain what's happening, who's HDL. We can add information like what are the standardized fees that are currently in our schedule with relation to the business license program, and some of the basic things that they may want to consider that may not be obvious for it to occur. HDL has also asked that we coordinate all activity through HDL, who is our business license program service, to ensure any questions about whether you qualify or don't, what documentation needs to be reviewed, all happens by those who understand our code and can apply and have that experience across more than 100 cities.
Thank you.
Thank you. I'm going to open public comment on this now. Nadine Swenberg.
Thank you, council members. I wrote something, but I'm going to speak a little differently after hearing that presentation, which I greatly appreciate. I am concerned about extending and amending the contract with HDL, especially considering the way that the contract is written and the incentives that HDL will have as an outside party when implementing an audit on the members of our community. I believe that we are being asked to spend an additional $193,500 in order to directly penalize the community because of a system that's fundamentally flawed. And that fundamental flaw is on the side of the town. Before subjecting at least 1,000 Los Gatos businesses and families to this broken system, we need basic transparency and functionality. So I would request that we delay this amendment of the contract with HDL companies. For some example and context, here's what I experienced when I recently tried applying for a business license. There were at least 6 broken links on the business license webpage. The Measure J link goes to a 404 page, and every single business resource link just loads to the same page. There was no accessible fee structure anywhere, not on the town webpage, not on the HDL website, and the HDL portal for application.
I had to hunt directly through town ordinances in order to find any fees. And in fact, the numbers in the town ordinance did not match the numbers that I was billed by HDL. Neighboring cities like Campbell and Saratoga do provide clear fee tables on their business license websites. And in fact, Campbell does contract directly with HDL, and they still manage to make this happen. The discrepancy between the amount I was billed and the amount in the ordinance from HDL comes to an amount of only $13.69, but it's still relevant. And when I contacted HDL with questions, they forwarded me to the town clerk, who was also unable to provide information. There was also a $40 processing fee that doesn't appear anywhere in town documents, and some other items. So how are you expecting a business to budget for any of this when the information is far from readily accessible and not even consistent across what we're seeing, what I'm looking at? So concern about the incentives is that because they're receiving a percentage of the recovered revenue, they are therefore profiting more when compliance is harder for our members of our community. So I don't think we should be paying a consultant who benefits from the transparency problems we need to fix internally. Thank you. I urge you to delay the vote.
Thank you. Any questions? Okay, thank you. Okay, anyone else online would like to speak about this?
There are no hands raised on Zoom.
Okay, so I will close public comment and go back to questions or any further movement on this with the council. I had a question. I had actually a couple of questions. One is ballot measure J, enacted in 2022, estimated 1.1 million in annual net revenues. I believe our cumulative amount with HDL is, I'm not sure what that amount is actually. Doesn't seem to be in the report, but are we realizing 1.1 million ongoing in revenues?
So the 1.1 million revenue was estimated based on the time on the actual gross receipt activity back in 2021. And when staff just reviewed the recent history of the business license, we experienced around $880,000 or around $800,000 more than our level was in 2020-21. So we are not experiencing $1.1 million, but the business license fee, license tax, is based on some gross receipt activity. If certain gross receipt activity change, then we are going to collect less business license.
So we're underperforming by about 300,000 a year. Is that correct?
To that, based on that analysis that was conducted in 2021. Yes.
So that concerns me. I would be interested in understanding that it's a substantial amount. So would staff be able to come back and identify what the difference is, why we're having a $300,000 shortfall?
The mainly of the difference is certain business gross receipts activity, and we cannot be very specific about businesses activity, but it's on gross receipt type of businesses that's not have as high gross receipts in the current environment than it was estimated in 2021.
Okay, I'm not sure I fully understand, but it sounds like you don't have that information tonight. Is the information on the $300,000 shortfall, is that something that could be provided to us in the future?
Gita, the question was, did our projections come true, or were we above or below? We're saying we were below by 300,000?
Yes.
So what you're asking for is for us to do an analysis across all of the potential revenue sources, businesses that we were predicting back when this was implemented, and to determine where numbers changed. Is that what you're asking in terms of the details?
Well, I'm not sure I need it business by business, but it would be good. It's a substantial amount, so it'd be good to understand at least whether there were some categories of businesses or other things. We may have misestimated what we needed to charge on some of these business licenses. So it would be, my sense is it would be useful to understand, that information about that shortfall.
And I can speak to that. It was an e-commerce type business that has less gross receipts in the current business environment that it was estimated in 2021. E-commerce type.
So it was a group of businesses that are e-commerce businesses?
Yes.
Okay. Okay. Vice Mayor?
Thank you, Mayor. So I wasn't around for the creation of Measure J, so please excuse my ignorance on this. When we're looking at the sample business license tax, retroactive 3 years, this chart here, is this set in stone? Are these rates and these numbers set in stone, or is that what we're talking about potentially playing with, amending?
So one of the modernization of the business license ordinance happened in 2022 was that we included a CPI factor, and that's increased the rate of the change from the original ordinance that in the town code, because since then every year, every January 1st, we are increasing the certain business types with CPI, and the town can post all of those schedule retroactively back since the ordinance to the town website. So I understand that's an important information. That was one of the reason, one of the changes with certain business type that time in 2022, and I'm just going from memory, the business license tax we increased in certain time 40%. Some of the business license type like small businesses wasn't touched, remained $75 annually. And we increased the categories in the e-commerce significantly.
Okay, and so those are those numbers plus the CPI. Are those numbers and those rates set in stone via the ballot measure?
Yes.
Okay. Thank you.
Councilmember Randy?
So if I can go back to the mayor's question from a different angle, we forecasted 1.1 million, I guess, a year in increase. Was that based only on who was already paying, or did it include us expecting to, collect from those that aren't paying? So, for example, this is about going and getting those people that are operating businesses and not paying. Was the 1.1 meant to include those, and part of the shortfall may be some less revenue and some not getting the businesses that are operating?
The 1.1 million estimate was based on the business license database, what we currently had, and the current gross receipts reporting what we had in file.
Okay, thank you.
Another. So my understanding is that we're focused on several categories. TOT is one of them. TOT can come from hotels, but it can also come from short-term rentals. Does the town require business licenses for short-term rentals?
So the town require business license for short-term rental, but the town also require a short-term rental permit. And our town code right now has written short-term rental permits has to renewed every year. It's not renewable, so not very many short-term rental application we have. However, I have on file. However, the town has an agreement with Airbnb, and Airbnb and the hotels are collecting if anyone is or any platform. So we are collecting the TOT and providing that information for us. But this, the HDL agreement, it would be a separate service to engage them with short-term rental audit or short-term rental compliance. So we're currently not included, but we are collecting TOT through Airbnb.
Right. That makes sense. So somewhere in the report it said that there are 1,000 unlicensed businesses. Does that include short-term rentals?
I don't no, it doesn't include short-term rental. Those are just regular businesses. And I just want to offer that there are 3,665 licensed businesses in town. So just to the comparison, and around $1,000 in an estimate. It's an estimate, and the HDL, the company, has to do due diligence when identifying those businesses and follow up with them.
Okay, so just to be clear, HDL does an audit of various businesses in town. We're not expecting that they're going to turn up a bunch of Airbnbs and VRBOs as part of that audit, and that's not part of our assumption because, and I think that makes sense because they're already paying, their taxes through the platform. We do get that automatically, so.
Yes, and with the Airbnb agreement, we don't know who is paying, but we just received the net TOT.
Right. Anyone else? Questions? Councilmember Badami?
Thank you, Mayor. Are we aware of broken links on the business license website, and if so, have they been fixed?
I've already conveyed to the finance director that we need to review our current website to the credit of the speaker to ensure that, 1, the information's accurate, 2, the links are correct, 3, any information that regularly changes due to CPI is adjusted on the website, and any information related to the audit is updated prior to us initiating this program. I think that's something we need to do first. Secondly, as it pertains to the 1,000 businesses, so I'm going on to some of the other questions.
Okay.
It was just an estimate by HDL. They did a preliminary sweep on the various data sources that they have, and they came up with 1,000 businesses that generally fall in the categories of the 3 bullet points in the staff report of commercial rental businesses, home-based businesses, of which we have a lot, and then transitory businesses that are not here necessarily 365 days a year. They may be here, doing 1-day service or a week service or a month service that still are required to have a business license to operate in our town.
And I just want to add one more thing. Thank you for the speaker who brought our attention. So we fixed those links, and then we removed the reference. But we will, as the town manager said, we will further improve and include information.
Thank you both.
Okay, Vice Mayor.
Thank you,
Councilmember Riston.
Yeah, sort of along the same lines. I think the questions and comments raised by the speaker are important, and sort of anecdotally, I have heard from some businesses that it can be difficult to do business in Los Gatos. I know there's differences across cities in the county, but I think in Los Gatos we really value being a place where it's easy to do business. We want a strong, vibrant downtown, and so my question on this is I see that we're planning to communicate this sort of through the chamber. 1, have we talked to the chamber about this yet? And 2, a lot of our businesses are not chamber members, and so how else do we plan to communicate this out to our businesses?
So just to answer one of the questions, we haven't talked to the chambers yet because we wanted to have this conversation with the council first and get direction before we do that. We have to use the town website, and obviously we will heavily rely on HDL because we are partnering with them, and we will just use with the town communication person as well. And
we are going to use the normal methods that we convey to the public already. There is also, chamber is an obvious choice because they're representatives of business, and they necessarily don't just represent their members. They also do activities that benefit non-members. The issue with the audit is really nothing's triggered until a notification actually occurs. There's a classification of businesses that may have not had a requirement that they receive a business license, although our code is written in a way that they should have, and that is something that HDL will be able to identify They will be receiving a notice. I can't necessarily find a method to contact those businesses to say we're conducting an audit. You may be identified as a business that requires to have a business license, because I don't have any information on file. So obviously our marketing has to be general. However, I've gone through this twice before already. There will be consternation in our businesses. There will be folks that are calling council members to try to intervene and to say I shouldn't have a business license. I was told I don't need one. And that's something that we need to navigate through HDL. What I believe is very important, though, you have businesses that may be paying and others that are not. The fairness occurs to treat both of them the same. Yes, we need to provide them accurate information, that it sounds like some of it's been updated, and we need to continue to ensure that that's accurate. Two, I don't think it's fair to tell a business you owe business license and go back in multitude years because they didn't pay for multiple years. We're only going to go back 3 years. And then lastly, a business should not incur a penalty until they fail to respond in a timely fashion, which is why I think we should be not incurring a penalty on a business until you've given them notice and given them a timeline to comply. And then if at that point they fail to comply, then you engage in that penalty.
Okay, great. Thank you. I agree with everything you just said. I think that's all going to be super important for as we proceed in this. And the last thing I would say is, being that the chamber does, represent many of our businesses and sort of, represents the business community at large as well as their members, I think it's going to be super important to work very closely with them on communicating this out to the businesses. And also if they see any major red flags, I really like the only going back 3 years. I think making sure, we have accurate information and are doing proactive outreach is all going to be important. But, I don't own a small business, so I think making sure the chamber is fully aware of what we're doing is super important as we proceed with this.
And that's a good suggestion. We should coordinate with them how we provide that messaging out in our frequently asked questions and any additional information that needs to be on our website to ensure that we take into account their unique perspective. There's one more piece that we should talk about. Business license programs can be one of two types: regulatory and non-regulatory. Regulatory meaning the business license is required and has specific requirements that occur. Non-regulatory, like grandfathered ones like ours, are effectively a tax. They don't give you the permission to operate. We will come across businesses that don't have a business license, that when we identify them and identify the business location that they are in, they may be in a place whose zoning does not allow for the business to operate. There is a risk that could be occurring. The approach we're going to take is similar to what we're doing on the 3 years only or 90 days before you incur a penalty, is to work with those businesses to offer them the opportunity to correct the deficiency. It may be they needed a CUP, but they didn't have one for that specific location or some other change, to at least offer them the opportunity and not necessarily go in and immediately cease and desist operation unless there's some type of exigency that needs to be considered in that process.
Mayor, do you mind if I continue on that? So,
go ahead.
So I think you bring up, thank you for I remember understanding that and sort of forgot about that piece. I think that's, I think that might be a place where we see the most consternation. I don't know for sure, but I think that's, that's significant. I think about someone like a Pilates studio or a chiropractor that, works out of an ADU in a residential neighborhood. And that, just philosophically is not something I have an issue with. And so I hope that through this, process, we can find ways to allow those businesses to keep operating. I don't want to be in the business of shutting down businesses. I don't think shutting down businesses is the goal of this, but I don't want it to be a byproduct either. And so if there are, a non-insignificant amount of, small individual run businesses that we're finding. And, I remember when I was growing up, my mom used to get her clothes cleaned by a person that lived on Carlton, where I live now, out of a fourplex there. And thinking about that, I'm like, well, that definitely wasn't allowed. And that person isn't there anymore. But I I don't have a philosophical problem with that. So I think that's going to be something important for us to understand what sort of the level of impact we're having on some of these, businesses that might be out of place in terms of zoning.
I don't know the full extent of what we're actually going to find, but you do have our code and the changes in industry don't match speeds. So things change and modernize in a way that our code does not. And so there are types of businesses that have now come to fruition that there is no explicit definition in terms of our code. So that's something we need to grapple, especially if it's going to be widespread. There are also other businesses where you don't traditionally associate your operating a business with a business license. I'll give you an example. If I own a rental property for which I have a restaurant within it in the downtown, the restaurant's required to have a business license, but technically so am I, who is utilizing that building as a commercial business. That may not be something that was traditionally known that both of those entities needed to have a business license. Then there may be some kind of tax structure that I put into place regarding that business that then triggers a third business, which also needs to have a business license. And then you'll get the complaint that says, wait a minute, I have this legal entity that's holding this property, that's renting to this business. The business has a license. You told me I need a license for the building, and now I need a license for the legal entity. That could be a potential. I've seen it happen, and it's confusing to the individual that structured it that way. But this is why we need to send them to HDL so they can explain. They can look at the documentation to see what is that structure and determine who, where, and what entity needs to have a license and what does not.
Right. And so lastly, I'll just say I don't have any issue with some of these, businesses like what we're talking about. I think about like a dog walker operating out of a home or I can think of 100 examples. I think that person should pay a business license fee. But what I'm hearing is there's the potential that they could be told they can't operate at all. And that's where my concern is and where I want the council to be updated on if that is more than a few businesses that we might be telling you can no longer operate. Does that make sense?
It does, but I don't know if we're going to run across, there's 100 home clothes washing businesses operating in zones, residential zones that don't allow for cleaners to occur. I don't think we're going to necessarily find that. I think what we will find is a handful of a specific type of business, or maybe even a one-off that's unique, that isn't something that fits into a box in the code. So I think the approach we need to take is, first, we definitely need to enforce the code, right? We can't just just look past what the code actually says. But we need to evaluate each case on a case-by-case basis from the perspective of we value our business. We also know our code isn't necessarily as modern as industry moves. And to figure out what is a good path that balances the benefit of the business, the need of our code, and the time necessary to adjust to facilitate what the council's desire is through its zoning policy.
Perfect. That sounds great. Thank you.
Councilmember Rennie?
So on this subject, I think you don't need to worry as much as you seem to be, because I'm trying to remember the code, but it's more focused on things that are disruptive to the neighborhood. For example, I ran a handyman business out of my house, and the town allowed it as long as I didn't store material. I don't have a bunch of traffic coming to my house. I'm not disruptive to the neighborhood, right? Nobody really knew. I got in my truck every day and went work somewhere, right? And so the code is designed to not be disruptive to things in the neighborhood. Maybe they'll find a few things that aren't disruptive in the neighborhood that happen, because of the way businesses have changed over time. But I don't think the code is designed to prevent people from doing business out of their homes. It's designed to keep them from being disruptive to the neighborhood. And so we'll see, I think you shouldn't worry as much, but if a bunch come up that look like they're not disruptive to the neighborhood, but they're violating the code, then we should go back and look at the code.
Okay, we have a number of comments. I don't know if we're moving toward a motion. Councilmember Risto.
Sure. Well, first of all, I think the point is well made that if we're charging a business license to some businesses, we should be charging it to all businesses. And I think that leveling of the playing field is a very compelling, story for all businesses to hear. And I agree we should be partnering with the chamber. In many cases, probably the first any business might hear about this is when they are found in an audit. So I have two questions. One is, in terms of what information we'll have on our website, who will be maintaining that and what will it look like? I mean, in my opinion, it should look like the town of Los Gatos. It should not look like HDL.
So the town of Los Gatos website and the content is maintained by the town. And we have a link to HDL in the town website, but we have many pages helping businesses, and the content will be maintained by the town. All the correspondence that HDL is sending on behalf of the town will be approved by the form letter will be approved by the town.
Okay, that was my second question.
It is a website. It's an HDL website for Los Gatos. It does have the town logo. It does say the town of Los Gatos Processing Center, but the information, the phone numbers, some of the emails go directly to HDL. So I think we just need to be clear that the town uses a third-party business license processor that processes this on our behalf and provide that information and make it, but they're authorized and official representative of the town.
Okay, so it will be accessible through the town website, and it'll go to theirs, and they'll be in charge of maintaining it. And because it also concerns me if HDL is updating things or corresponding, and then we have to have a town employee constantly updating a second place, that doesn't sound efficient either.
No, it doesn't, but I do think a town employee should be validating anything that is changed if it's not changed directly by us, even if it's on the page of our third party.
Okay, and then the follow-on to that is, and I think maybe you answered that when you talked about correspondence, the letter that will go out for compliance and all correspondence from HDL will it look like it's coming from the town or from HDL or HDL on behalf of the town of Los Gatos so that
it's
the recipient understands?
HDL behalf of the town of Los Gatos, but even when we started to use HDL, we reached out to every businesses in a letter and introduced that we are partnering with HDL. So we will make sure that it's very clear for the businesses that are receiving the audit letter.
And this is where the FAQ is important to ensure that if I receive a notice and I go, is this legitimate or is this a scam? I can go to the website and see exactly what's happening and say, yes, this is what we're doing. This is who they are. If there's some concern of wrongdoing, this is where you go.
Okay, yeah, I think that's important. I'm ready to make a motion unless there's...
I just want to highlight one last thing of what was mentioned publicly. The contract for the audit service isn't the total dollar amount that's in the staff report. The majority of the cost is to continue using HDL as our business license servicer. So in lieu of us having staff that are actually doing this work, we've been contracting with HDL to provide that service. This contract's continuing that. So only a smaller portion of that total dollar amount goes towards the cost of some of these audits. But it is true that there is a recovery, a one-time recovery, that if HDL find a business license a business that's not currently licensed, I get a percentage of the recovery just that one time. And that doesn't continue going forward. It's only if they find something. We could change or ask to change the model that we pay a fee and not do a percent recovery, but then we would actually be paying whether or not you find businesses or not. And I haven't seen them actually use that model. In the last two cities I used was the same model that we're proposing here.
Okay, before I make the motion, then I have one question. When you say a portion of the recovery, if the recovery is the business has been out of compliance for 2 years, it's off the 2 years or up to 3 years?
Correct. It won't be for the next 10 years as that business continues to operate. 35% of that will continue to go to the third party. It's just, I found this business, I get 35%, and the rest goes to the town.
Okay. All right. Well, I'm ready to make a motion. I move to authorize the town manager to execute a fourth amendment with HDL companies for business license discovery and compliance audit services, sales and use tax management and audit services, and transient occupancy tax, TOT, audit services with a total contract not to exceed of $451,500 plus CPI, and approve a resolution granting a waiver of business license late fee penalties for businesses undergoing the business license discovery and compliance process.
Councilmember Annie?
Question whether maybe you want to amend it to include some of the things the town manager mentioned, that he said he would make sure were done before we started this, making sure the website links are all working and so forth.
Do we need a motion for that?
We would do that anyway. So.
Whether we believe they're going to do it anyway, or we want to include it in the motion to make sure it's done.
Okay, is that a friendly second or amendment and a second?
Yes.
Okay, accepted.
Okay, so I have a comment that this is a substantial amount of money going to HDL, $451,000 plus 15%, plus 35%, plus 25% of different categories. I'm not comfortable with the shortfall and the explanation of the shortfall. When we go to the public with a ballot measure and we do an estimate, I take those numbers seriously, and I think that if we do not achieve those numbers, we don't need to kind of drag it out. We need to come forward and say, you know, proactively, this is what's going on, and I am not comfortable in moving forward with this without a better explanation of why we are now $300,000 short, and we're paying $451,500 plus extra for services. So it just doesn't add up to me. So at this point, I'm not able to support the motion. Councilmember Badami?
Yeah, I'd be in favor of a continuance where we can get an explanation of the shortfall and also assurance that we have a working website that's up and ready for us to move forward with this.
Yeah, that could be offered as an alternate motion, or we could continue discussion.
I can offer it as an alternative motion if I have to reword it, but I think what I just added should be sufficient.
Continuance, right? With
a continuance.
Right. Vice Mayor?
Thank you. Yeah, I my understanding of reading through the lines on this is that I think we have a pretty good explanation of where the shortfall was. We have a significant business in the town of Los Gatos that we based a lot of this on that it sounds like came up short, which makes sense to me. So I don't know what else we would need to make a decision.
Well, I guess we all have our opinions about what information we need to make a decision. I will second the alternate motion. And so we have any further discussion? Then I will call the question on the alternate motion to continue the item with the additional explanation that's been requested. Okay, I'll call the question. All in favor?
Aye.
2 votes, so it fails. And so we come back to the original motion. Any further discussion of the original motion?
If I may get more definitively the amendment that was made, what exactly is in there? Is it just ensure we verify the accuracy and update the websites that are used prior to initiation of the audit?
Yes, make sure all the links are working. I mean, the term that was just used is make sure our website is up and functioning. Well, I think it's up and functioning, but, you know, let's have somebody run some nickels through it and look for some weak points.
So is that clear, Town Manager?
Yes.
Okay, call the question. All in favor?
Aye.
Opposed? No. Passes 3-2. Thank you. Okay, we will take a recess now for 10 minutes and come back at 9:35. Thank you. Ready? Okay, Town Council is now back in session, and we are ready for item number 13. And I had asked that we get an update in this time frame and on our wildfire preparedness, resiliency, prevention, and with the hiring of our new town emergency manager, we have made significant progress. I also will be asking for another update in December, probably at the first meeting in December, because our residents want to know what are we doing to help prepare. So with that, Mr. Todd, thank you for coming, and we look forward to your presentation.
Great. Mayor, Vice Mayor, Council, thank you. So I appreciate the opportunity, and next slide. There you go. Okay, so just to, for this presentation, kind of give some background and context to kind of help understand what our wildfire risk is generally, a little more specific to Los Gatos than we might normally see. Kind of touch on what the work that we've been doing and are continuing to work on, and then addressing some potential future actions. Oh, is that you or me? Okay, there we go. Okay, so starting with the context for this, I'd like to show, this is the National Risk Index. This is a metric put out by FEMA, and it's based at the county level. And there's a few things to take away from this, but one of those is kind of the background information for how we used to look at risk. And this, although this is still a current metric, they look at this based on historical averages. So the ranking is still accurate. We know that earthquakes are top hazard, followed by wildfires. That's fairly common sense. But one of the key takeaways is our annualized loss, and that is based on historical averages. So we know from '89 that the high cost that was associated with that. However, countywide, looking at wildfires that were large enough to displace populations, we don't have a lot of history of that. So we're looking at $8.4 million annualized. That's clearly not an accurate metric. So we know, and as insurance companies, everyone else have slowly figured out, as well as CAL FIRE and our new hazard assessments, that those numbers are no longer accurate. We have, based on property values, mostly our top 1% for disaster losses as a county. And we have 4 in 10 of our Los Gatos addresses, homes and businesses are located in the WUI. But as we know, the WUI boundary is no longer just the WUI boundary. There's other hazards to be considered. And when we look at fire losses, we can look at, say, just the CZU fire alone. That was an estimated $2.5 billion. So clearly these metrics are no longer valid. Now, moving on. Addressing the wildfire history for our area. So there's a few things to take away here. If we look at that map, the color coding there, you can see that this is the history of wildfires to our area going back about 75 years. However, it could probably date back more closer to 100. And you'll see that there's no color maps or fire boundaries that get any closer than about Lexington, with the exception of the Katz fire. So we have a deferred history of fires getting within close to our area. And if we look at the graph there, we can see that the fire frequency is increasing, but the size of the fires is decreasing, with the exception of the CZU fire. So what that's telling us is that we're getting more starts and we're getting better at putting them out. But with that, we're deferring the risk, because fire is inherently a natural process. Now, I found the earliest aerial photographs I could find of our area. So if we look kind of downtown College area, we can see 2 distinct things here is the 1948 to today. And what you can see there is that we went from having open space clearings to rather continuous fuels as you move from basically the wildland all the way through downtown, be it dense vegetation, housing, everything else. These are all continuous fuels that can carry fire through into our area. And to note, historically, our area was oak grass woodland. We disrupted that when we stopped the fires that naturally happen in our area. So as we did that, though, those were generally replaced by logging, farming, things like that. We have thus stopped that process completely, and now we have homes that are built in that place, and on top of that, we have vegetation that's increasing in density every single year. There's a metric called the fire return interval, and so for our area, historically, there's supposed to be a wildfire about every 10 to 12 years. So every 10 to 12 years, there's supposed to be a fire that burns through and clears out the chamise, the dense vegetation, and returns it back to grass and oak. So as we've disrupted that cycle, that ownership is now on us to either mitigate those fuels or to harden our homes or do both. So in that effort, we've done a few things. I'll just touch on a few of them. A lot of the valuable work that our Public Works done is our fuel reduction projects. So they've treated their over 194 acres of open space, moving into their projects for road clearance as well. Community engagement. So we've done a lot of Firewise outreach. That's, I believe, been highly successful. Make sure that we're getting kind of a whole community approach in there. So the amount of work that needs to be done can't be done by us alone. It needs to be the community involved in that as well. Let's see. The risk reduction community certification, that's one I really want to highlight. So that and Firewise, both of those can support improved wildfire insurance as well as grant eligibility. So as we can improve the insurance premiums and availability for our residents, we're improving their ability to respond and be better prepared for these fires. Internally, we're conducting ongoing training. We just finished an update for our emergency operation plan. We're beginning the rollout of a new virtual EOC platform. We are moving forward with several initiatives from grants. So we're looking at the updated vegetation management plan, the evacuation modeling. So we're working with companies hopefully to get somebody on board to help us do a complete evacuation plan for the town. And in addition to that, hopefully getting grant funding to support wildfire evacuation sirens. Looking at the budget and the money that's been spent so far, I just want to touch on that. So we've spent up to date about $39,000. This was largely for salary, public outreach, as well as grant writing support. There's the $80,000 that was allocated for the tree removal on Hilo Road, as well as for our grant matches that we've set aside. This can vary between $462,000 to $550,000, depending on which grants are realized, with the remaining funds of between $330,000 to $418,000. Now, considering initiatives going forward beyond the ones that were already mentioned, there's things that we can consider as we do get a traffic flow mitigation plan. We can consider what issues were identified in that and future actions that were recommended from our contractor and potential improvements for traffic flow or mitigation measures. Improvements for our wildland interface, so exploring opportunities to improve the transparency and what our metrics are for our community members and identifying any barriers they have for improving vegetation clearance on their properties and what we can do to help support that. Expanded fuels reductions, so there's multiple things that can be done in this area that this is not a thing that can be done on ours alone, as well as this is an expansive project that takes extreme emphasis. It should be known that we need to be working with our neighbors, so there's efforts ongoing so we can work better coordinating with Saratoga, Montserrano, all of our neighbors, as well as Mid-Penn, San Jose Water. And in support of that is understanding of fire modeling so we can target our vegetation in the most appropriate areas so we can maximize our dollars. Continued community resilience measures. So again, continue to engage with communities. So as we identify future mitigation actions that can be made, how can we engage with the community, help them better be prepared to evacuate and test those metrics. And that is the end of the presentation. I will note that we did have a resolution prepared for the adoption of the emergency operation plan, and that was largely done due to the amount of time since the last time we adopted it, so we wanted to make sure that council was aware of all the updates. And with that, I'll wrap the presentation. Thank you.
Thank you, Vice Mayor, and we do have a number of public comments, so we'll start with the vice mayor, though.
Great, thank you. Yeah, I wanted to ask a couple of questions, and then I can ask more later. But sort of using the Sam Liccardo press conference as an example, I've been impressed with the sort of tone shift that I've seen in some of how we're talking about wildfire preparedness, and I see this on options for expanding evacuation drills and preparedness exercises. I think it's important that we continue to emphasize the sort of personal responsibility and homeowner responsibility in terms of how we as a community prepare, and understanding that the town does not have unlimited resources to mow everyone's lawns. And so I wanted to ask, in that vein, are you thinking about that as mostly a communication project, or going into communities and doing some of these drills? How are you thinking about the sort of responsibility of individuals in the town to contribute to preparedness?
I think it's a multi-pronged approach. There shouldn't be just one measure, but it needs to be an education and overcoming. There's a natural bias for people to understand the risk level that they face as residents to their own homes, understand the importance of this. So we do need to educate them and encourage people to do these actions, and through things like FireWise and community engagement. But in addition, I do think that we should be proactive as well when it comes to measures like weed abatement, things like that, making sure that people are doing what they are supposed to be doing.
Thank you.
Okay, thank you. I'm going to go to public comment because it is getting a little bit late, and then we'll continue to discuss this. So Rob Stump, and then Peter Hertan.
Thank you. My name is Rob Stump, hillside resident of Los Gatos and a member of the Planning Commission, although I'm not here tonight representing the Planning Commission. First, I again thank the town for hiring Chris Todd as our emergency manager. He's an excellent addition to the staff. Tremendous progress, as we've just discussed, has been made on critical wildfire initiatives. In the report presented this evening, 3 wildfire initiatives are laid out: evacuation planning, an outdoor warning system, and roadside vegetation management are either in the planning stage or underway. By implementing these initiatives, lives will be saved in a worst-case wildfire scenario, and property will be protected. The town is working on the right priority initiatives. This past March, as you know, the mayor formed a wildfire advisory group made up primarily of community members. The group submitted a report to the town in May recommending wildfire initiatives in a very similar priority order: emergency communication, evacuation planning, roadside vegetation management, defensible space, and home hardening, which is critical. These initiatives require ongoing investment by our community. The report identified almost $45 million in work that needs to be done to support wildfire initiatives over the next 20 years. Where will this funding come from? That is yet to be determined, but one thing is certain: funding needs to come from a reliable and repeatable source. To reinforce its importance, I will briefly address evacuation planning and roadside vegetation management. Emergency communication and defensible space home hardening, in particular, as was mentioned, FireWise Community Initiative, will be addressed by my colleagues. Evacuating residents in an efficient and safe manner is of the utmost importance. We must create a specific and comprehensive evacuation plan that incorporates impacts such as school and beach traffic. Once the plan is in place, as you've heard tonight, regular drills must be conducted, including community involvement. Evacuation planning is not only the right thing to do, it is now the law. A comprehensive evacuation plan will save lives. The town has also done good work, as we've heard, on roadside vegetation management. But why is this work so important? 85 to 90% of wildfires are human caused, and the majority are started within 50 feet of a roadway. Ongoing vegetation management on our 31 miles of town roadways through the WUI is critical, and it should be managed on a 6-year trim cycle. Weeds along these same roadsides should be cleared 1 to 2 times per wildfire season. This work will save lives and protect property. In our own neighborhood, we just spent $25,000 clearing weeds and brush from the town right-of-way and 3 private roads. And so that's a gap in our funding that ultimately does need to be addressed, but until that time, the community is going to step up and take care of it. Again, this work will save lives and protect property. Reducing the risk of wildfire in Los Gatos requires planning that you're seeing being done. It requires funding, and it requires vigilance. Lots of good work, as we've talked about, is being done, but there's much more to do. Thanks again to Chris Todd for his determination to develop and implement a comprehensive wildfire plan. As a community, we need to get behind Chris and the town to get critical work underway and completed. Thank you for your time this evening.
Thank you. Right on time, Mr. Stump. I had actually a question for you, but I also want to acknowledge the Wildfire Advisory Group that has been advising me in helping me to come up to speed on the kinds of things that we could be doing. And that would include, of course, your leadership and organization, Councilmember Badami, former Mayor Joe Przynski, Jason Krings, Brad Gordon from Red Cross, Rhonda Rader, who's here tonight, Peter Hertan, Dennis Lawley, and others from Santa Clara County Fire, Chuck Page from Saratoga, and Everett Wolsheimer from Monte Sereno, and we've also had guest appearances from Allison Zeidler and some others, and it's been really enlightening because when I started to understand the possible things that we could be doing, one branch are things that can be led by the municipal government and are on public property, essentially roads and that type of thing. There's a whole other branch that the vice mayor alluded to, which is what happens on private property. And so when you mention the $45 million, does that include private property remediation, or is that public?
It does not include private property remediation. In fact, as we've tried to go through and calculate that, we've calculated that in the town of Los Gatos, the 3,100 plus homes that are in the WUI may spend upwards of $6 million a year between vegetation management and home hardening already. What would it take for the town to invest $45 million over 20 years? That's about $2.2 million a year. It would look like the community might outstrip the spending by the town by about 3 to 1. So the town, the community is involved, but we want to see the community involved even more, and that's why this FireWise initiative that's been launched, again, with Chris's leadership and assistance, is so critical to the town of Los Gatos for accountability, participation, and education.
Great, thank you. And I also want to commend the group and Chris Todd for collaborating so well on this issue that's so important for our residents.
Thank you.
So, Peter Hertan.
Thank you, Mayor and Town Council. I'm going to be very, very brief, which means I'm using notes, which I never do. So hopefully I can read them. So I'm a member of the Los Gatos Wildfire Advisory Group, and I'm here to speak in support of a very narrow item of the proposals, and that is the wildfire audible alert system. You may recall I was leader of the Los Gatos Monte Sereno Aries Races Emergency Communications Volunteers for 7 years until I found a perfect replacement and I retired. With that background and my current FireWise community activities, I want you to know that I fully endorse the staff recommendations presented tonight for wildfire alerts. In particular, the use of long-range audible devices, or known as LRAD, for placement at critical locations throughout the WUI. LRAD provides an essential alert mechanism when phones, the internet, are insufficient, either because they're overwhelmed or they're dead. And the alternatives in the past were radio-based. Nobody listens to the radio anymore. You listen to your portable device. So the proposal for an audible alert system, which is both siren type as well as voice to give direction of what the specific alert is, will save lives in Los Gatos. So it's a substantial investment, but absolutely essential. So I want you to feel that the community supports it. Thank you.
I had a question before you sit down. In reading the emergency operations plan, which I think we've made tremendous progress on that plan, one thing it doesn't mention, I don't think, are GMRS radios for the neighborhood communication to ICPs. And I wonder if you have any advice on the use of that type of communications in emergency planning.
I'll try very hard to keep it within 3 minutes.
No, not even.
I know. So I actually had this discussion with Rob earlier today, because we're trying to have the WUI community form fire-wise, fire-safe communities. We have 3,100 families, and the average fire-wise community, of which we represent the two that exist in the town, his is 83 homes and ours is 33 homes. 3,100 families will translate to 100, anywhere between 30 and 100, depending on the size of the group, fire-wise communities. Every one of those will want to have a communication plan of their own when there's a fire, which says that you can't just worry about what does one group do to provide communication between themselves or to a local CERT location. With all of that, all the numbers of families that will be involved, every radio system will be overwhelmed. So the notion of using GMRS is essential, and that's what CERT has adopted. But now to add another 3,100 people onto that limited number of radio channels is just something that really has to be well planned. And it can be done, but it takes a lot of planning. So I didn't have that in my remarks because it wasn't part of what was being presented tonight. I think it will be at a future time. Meanwhile, we'll be doing the basic technical work to make a recommendation that goes along with what we did as a wildfire advisory group, so that the town staff can decide how much of it they want to support. But
Great.
It's not going to be inexpensive.
No, right. Thank you. Rhonda Rader.
He just told me to get him. Okay. So I'm Rhonda Rader, a Los Gatos resident since 1984, and I too want to thank the town very much for bringing on Chris Todd, because his leadership is fantastic to help make us a safer town. And I say this with great passion, having just visited some friends in Altadena and seen what happened to their neighborhood. So what can we do to not be like that? The vice mayor was talking about the collaboration that's necessary between what the council does and what citizens do, and that's what I'm going to talk about is what FireWise entails. And my credential is I, along with Peter, helped start Los Gatos' first FireWise community. Rob here was number 2. Okay, so. Why is FireWise important? The data show that the two things that regular homeowners can do to help mitigate risk is to harden their homes and to prepare defensible space. And it's particularly important in the WUI where I live. So how do you do this? Fortunately, there's the FireWise program, which is already established. It's a framework, a national framework that helps neighborhoods
band together to take steps to harden their homes and do better defensible space. And these things aren't necessarily expensive. As an example, one recommendation is that you replace your foundation vents with 1/8 inch mesh instead of 1/4 inch mesh. Another one is that you replace things like tan bark for landscaping with pebbles or decomposed granite. So the town's 2 existing Firewise communities represent, as someone mentioned, 122 homes. So we've got about another 3,000 to go. And we're making progress. The goal is that eventually all the WUI homes, it would be Firewise communities. Chris has a more manageable goal. We're going to start with 7, and the 2 meetings that he led in August have already ginned up significant interest. And those of us here and some others are helping to, you could say, sponsor these other neighborhoods to help them through this process to make it go a little, faster. So summing up, I encourage the council to give, to continue collaborating as well as they have been with residents to make communities safer, and that would include, funding, when needed. It's a big payoff because it's lives and property. Thank you.
Thank you very much. Any questions? Councilmember Badami?
Thank you, Ms. Rader, for being part of the group. It was a pleasure to work with you and understand how you and Peter formed the first Firewise community. And Mr. Stump being the second, that's no small feat. But what I'd like for you to do is if you could expand on any added bonus of being designated a Firewise community.
Well, as you allude to, the main benefit, of course, is saving lives and protecting property. A secondary benefit, which was the primary benefit when I started, initiated our community, is the significant insurance discount that insurers award to households that are in a Firewise community. Mine was, approximately $500. One of my neighbors got $1,000. So this adds up over time, and you can think of it as a way to finance some of the home improvements. Thank you for asking that question.
Thank you.
Okay, thank you. Linda Swinberg.
Hi, I'll keep this really brief. I don't live in a WUI, but I live near one, as do, I think, probably all of us here. And I've lived in Los Gatos since 1995, but prior to that, I lived in Pasadena and really right near Altadena and know that community very well. My heart really goes out to them. And we did experience large fires while I was there in Southern California, right in that same community, same canyon, everything. My question, or not, I guess I can't really ask question, but my concern and something that I really want to bring up to the council in particular is that I think we might have some conflicting ordinances on the books that might be in conflict with what we want to do here. When I moved into my home, there were a couple of very tall and very diseased pine trees that I needed to take down, and I had to obviously pay for the removal permit. I'm wondering if we really want to keep replacing these trees, if we really want to keep this type of vegetation cover that we now have, or is that a risk? And I'm wondering, I'm hoping that that's looked at and that we evaluate and assess that and see if maybe we need to make some changes in philosophy, or maybe not, but definitely I think we should look at that. And then the other thing that I wanted to ask about is that you really consider this highest priority, which I think you are trying to do, but in evaluating other projects that we are considering spending a lot of money on and are unfunded currently, I would prefer the money be spent on this, on keeping us safe now. Thank you.
Thank you. And I just wanted to comment that there are a lot of actions that are beyond what's in the report tonight. And one of the things that I think is really clear that you brought up is that we need to take a hard look at our ordinances and our zoning and our building codes. Some of those we want to do on a regional basis with neighboring cities as well. So there's a lot of work that's going on with Saratoga and Monte Sereno and others to have some consistency in that area. But you brought up one that is, right there on the list about one of the things that I think we're going to need to address. So thank you for raising that. Okay, I don't have any more cards. Is there anyone online who'd like to speak?
There are no hands on.
Okay, so I'll close the public comment. And are there other questions that council members have? Councilmember Rennie.
Mine's maybe a little more of a comment, or maybe it's a response to the comment as the question. So it's really good on here that we have a focus about when a fire comes through, we're getting our people out, right? We're making sure we're going to model our evacuation routes, figure out how to get people to come out in pieces so that we're not overloaded. We're making sure we're spending most of our vegetation removal on our egress routes, right, for getting people out safe. We're doing some, but it seems like, and I guess our resources are limited, so we want to make sure we can get our people out safe first. But it seems like we should be also focusing more on how to keep the fire from spreading, or how to keep it from getting into Los Gatos. And there's a tendency to kind of be silo. We're Los Gatos, we're going to just do what's in Los Gatos, but fires don't stop at the border, unfortunately. We can't say fire don't come here if it starts somewhere else. So I'm thinking there should be more thinking outside Los Gatos. For example, they're putting the N5 sensors in various places around the county. We should look at where do we think fires could burn through and catch us the most in trouble. For example, at the top of Cypress, coming over from Cypress, coming over the top on Foster, right? These are all areas that aren't in Los Gatos, but those are areas that are going to affect us the most because we've got people with one-way outs in there, kind of thing. We should be looking and influencing where they want to put it. The N5 sensors, for example, I'm sure there's many other solutions, but that's one. Look and say, okay, if we think this is where we're most vulnerable, let's make sure there's sensors there so we get the earliest possible warning to start getting people out of those areas. The sensors are very sensitive, and they can, before a fire even really has flames, they can start telling you that something's going on. So I'm trying to encourage us to think outside of Los Gatos also, and that also includes what is near us where the vegetation really is in bad shape and really can get a hot fire going and get a hot fire coming into Los Gatos, right? The old fires I think you talked about in the old days when you had oaks and grass. Well, fires were okay because they didn't get hot enough to burn everything down. How do we get it so that fires don't get hot so fast? And where are our vulnerable areas that might lead into Los Gatos? And so I'll say that we are putting a fair, or maybe a really good place to also put effort, as we're mentioning, is in the home hardening and the fire safe, because it does double duty. It helps to make sure people are safe, which is a lot of what we're focused on here, which is very important. But it also helps to keep it from spreading, because if you can keep people's houses from catching on fire, that's where a lot of heat comes from. If people's houses aren't catching on fire, they're not spreading to the next house, they're not spreading further into Los Gatos. So that really feels like an area to put a lot of effort in, because it hits both of them. But I think my main thing is also don't just think siloed Los Gatos. Think about where's it going to come in, and what can we do, or how can we influence the county or Mid-Penn or San Jose Water or these other places to make sure they've cleared what's going to affect Los Gatos, because they're thinking, the whole region, their whole property, whatever. But we need to worry about Los Gatos. Let's advocate for places, them doing their work in places that affect us most.
Good. If I may comment.
Yeah, of course.
I could talk about that for about an hour. There's a lot of good points in there. So we have, as I kind of already indicated, we have a very substantial problem with the amount of fuels and vegetation and the energy that's stored in the hillsides just outside of Los Gatos. So cooperative is absolutely needed. And I failed to kind of emphasize the work that is being done outside of our area with between the Fire Safe Council and some other initiatives for clearing fuel breaks and stuff. But even that is a drop in the bucket compared to the scope of the work that's needed. So as a town, yes, we need to collaborate with them to figure out how best we can work on the projects that surround us. In addition, when you mentioned the N5 sensors, they're working right now to install the N5 sensors that surround our area. They don't yet have locations designated for that, so I wouldn't rush out and get our own sensors until we have a better understanding of where they're going to be. We might already wind up with coverage from that. Now, when it comes to the work to be done, I think their good reference point there is what happened for Paradise following the campfire. They came out and said that they explored the concept of putting a fuel break around the entire town, and estimates came back around $3 million a year annually to maintain that, and it wasn't feasible. So then what they did is they went and conducted fire modeling to assess what was the highest risk and probability of fire coming into their town, and that's where they made easements and conducted the work, and it was substantially more feasible. As we work through this process, one of the things that we're hoping comes out of our evacuation transportation model is that whatever company we've asked them to include fire modeling into those assessments, and with that, I'm hoping that we can get usable data out of that that could also then be used to support things like identifying priority locations for actual fuel reduction beyond just the roadways. So I agree with everything you just said.
That sounds great. I'm glad to hear that. Thanks.
Vice Mayor?
Thank you. A couple of questions. One, I think the LRAD grant and initiative is something that's worth a lot of effort, and I'm really glad to see that moving forward. That's, when I talk about this topic organically, people talk a lot about that. I think conceptually people understand that if there's a wildfire in a hillside area, all kinds of communication networks get knocked out and people need to know what's going on. Do we have a timeline on if we were, or I guess when we would hear back on that grant, and if we were to be awarded that grant, what the timeline would look like on that?
Not exactly. It was submitted, when was it submitted? On Monday morning. And that's going to go to Cal OES. It'll go to review for them for a couple of months. And from there, they forward that on to FEMA, and FEMA can hang on to it for quite a long time. So they don't give us a definitive timeline for that.
Okay, I appreciate that. And then, to Councilmember Rennie's point, especially on cross-jurisdictional collaboration, I think that's super important. I've been really grateful that it seems like our congressman has been really prioritizing that and pulling people together across, all of the fire risk communities in our area. Do you feel like, and this is a general question, do you feel like in Los Gatos at this point right now we have the resources to match our capacity for what we can work on over the next 12 months or so? I know this is all going to change with grants coming in and out and that sort of thing, and those would be great, but being that this is such a high priority, do you feel like you have the resources you need right now?
I would say yes. You saw our budget. We're well within the scope of that for the work that we're doing right now, but that doesn't quantify the amount of vegetation management, things like that need to be done. And so that going forward, there is going to be substantial expense if we actually wanted to do the level of work that should be done. And one thing I think that should be noted when it comes to that is, as these fuels have built up, there's a substantial amount of initial work that needs to be done to bring that back to a more manageable level. So the heavy-duty mastication and fuels work and everything that has to be done before then, once you can get into a more regular treatment cycle, in which case the cost will then go down afterwards. You could do control burns or more manageable solutions.
Okay, I appreciate that. And one more quick one. I have heard from several people that, and I've heard this said in different ways, so I want your expertise as a fact check, that the town of Paradise had a higher or a lower fire risk rating than Los Gatos when it burnt down, that Los Gatos has a higher fire risk rating. Do you know if that's true? And there's all kinds of fire risk ratings, hazard severity zones versus, all kinds of things. Is that true? And what is that based on? Because again, when I've heard people say that is something that is a super tangible, I think, education and communication tool to say, oh my God, we really need to prepare.
I can't speak specifically to what the risk level or assessment was for Paradise. What I can say though is that I was very familiar with that area. I was a firefighter very close to there. They have a slightly different fuel model than we had. They had conifer trees, and it was generally more open than we have. We have very dense vegetation here. However, they had a very different weather pattern than we do. The Feather River Canyon runs right next to them, and it does a big U-turn right at Paradise. So they would consistently get strong winds that would blow through Paradise, and that's what drove the fire through there so quickly on that day. So we have our own problems, but they're not exactly the same as what Paradise had. Which one is higher, I couldn't say.
Okay, I appreciate that. And the only feedback or direction I'd give on that, I think, is, we talk about, it's very easy to get pretty technical when we talk about, wildfire preparedness. And, the second you say something like WUI, 90% of people's eyes glaze over because they don't know what that means. And so I think as much as we can point to examples and provide real tangibles for, whether or not our risk is, greater than Paradise or not. If there are examples we could provide like that, comparing ourselves to other communities, I think it's very helpful for people to visualize the risk.
Agreed.
Councilmember Risto.
Thank you. First of all, I appreciate the update, and it is really great to, as time goes on, see the traction that is going forward with wildfire preparation. And we've had community members involved for a while, and that's been helpful. But I think having you just pulling everything together is going to be really key, and with your leadership and with the grants we can get. So I appreciate that. I had two comments or questions. One is, I think the audible alarm system makes a lot of sense. I think we know in the old days that worked really well. I mean, I grew up in the Midwest, and that's how tornado warnings were put out. They also were on the radio and the TV, but frankly, we weren't glued to our screens as much as people are now. And so you could miss that. So I think that is going to be really critical. The other thing is when we talk about evacuation, and I've talked about this with other people, it's going to be one thing to get impacted neighborhoods out. And then the next question that I'm sure will be part of the modeling is where to? And one of the things I think about a lot is everybody doesn't need to get on Highway 17 and get trapped in their own traffic jam. So I don't know if part of evacuation will be determining where are safe spaces, even within the community. Where would we have hardened places? Yeah, and can we work with larger places to make sure that they are fire hard, like Los Gatos High School, like Calvary, like St. Mary's, or how far do people need to go? And I know it'll depend on the area of the fire, but I think it'd be really helpful if we can work with some of our larger establishments or places with large parking lots to understand how hardened that is and in what type of fire that's a reasonable thing to walk to, bike to, or drive to, as opposed to everybody getting on the same road. Is that part of the evacuation thought?
That's not in the RFP that we have out right now, but that is definitely in the consideration of a total plan. Certainly we need to know where people are going to go. I think the first step is to identify our traffic patterns first. Now that said, is the community has definitely been actively engaged in wanting to know where should we go, what are our safe refuge sites. So I totally appreciate that. And we do have large areas that could be considered in this, like large park spaces, or the high school is certainly a stronger structure than others, but it would take some careful consideration of how much people are going to move in there, how long it's going to take them to be there, how fastly can they move out of that location. There's a lot of factors that go into it. But yes, considering what sites we can move people to is definitely one of the goals.
Okay, thank you. Because, what my consideration is, if there's a wildfire nearby, I am not getting in my car. I am not going to be somebody trapped on the road. I'm getting on a bike, or I'm walking a few blocks if I knew St. Mary's was a safe place, for example, and it's only a few blocks away. So I think the more we have options and the more people don't have to get into a car. If you have to go a long distance, a car makes sense. But if you're just trying to get through clogged streets, getting in a car might not be the best option.
Yeah, part of that too would be a discussion with County Fire to determine the size of evacuation zone that they're going to set. So if they tell us to move out beyond where we would already have a refuge site, then it's
Right.
a very case dependent. And then that goes back to the fire modeling, understanding the risks as well. So it's multi-pronged.
Right, I realize it'll be dynamic. It depends from what direction is the fire coming, and that'll also impact all of the evacuation, right?
Yeah, absolutely.
Thank you.
Thank you. And I dove into the report and your presentation. Really, I have to comment that since you've been on board, we've made tremendous progress in just several months. And it shows what can happen when, as a town, we focus on things that are so important to us. I would encourage that we do another update around December. And what I would really be interested in then is what are some of the longer range public safety costs that are possible, particularly from the public side, in the categories of evacuation management, fuel reduction, vegetation management, defensible space, home hardening, education and outreach, and emergency communications. And, I know it was a tremendous start, but I do think we have to demonstrate that we are in this for the long term. And if it's anywhere near close to the number that Mr. Stump suggested, we need to have some idea about that so that we can figure out how to prioritize that, and frankly, how to obtain revenues to cover that possibility, because what I hear from our residents is that it is the highest priority of all the things that we do is public safety, and particularly mindful of the wildfire danger. And so it would be really helpful to get our arms around what are the longer term funding requirements that we're going to need to enhance public safety in the community. So thank you again. I don't know if there's any other questions. So with that, again, thanks for the report and for the work. And we do need a motion on the emergency operations plan. Yeah. Councilmember Risto.
Okay, thank you. Thank you for the presentation. And given that we have an updated emergency operation plan, I move to adopt a resolution adopting the updated emergency operation plan as outlined in this report.
Vice Mayor?
Second.
Further discussion? No, I did have a chance to read through all of the report. I think we've made excellent progress. Essentially, the report hadn't been touched since 2016, and so it is encouraging to see how much progress we've been able to make in that report. I have some individual suggestions that I'll pass on to you, about enhancing it going forward, but we're in much better shape having that in place. So with that, I'll call a question. Favor?
Aye.
Aye. Passes unanimously. Thank you very much. Okay. We deferred item 14 to future council meeting. So with that, we have council matters. And so we have the normal part of council matters which is our calendars and activities that we have been involved in. So why don't we start with that, and then there's a specific request that can come from the council members who have put that forward. So I'll start with Councilmember Rennie.
Since our last council meeting, I have nothing of interest to report.
Okay, Vice Mayor.
Thank you, Mayor. So I had a variety of meetings. I attended alongside Councilmember Risto the West Valley Community College Universal Food ribbon cutting and with the town manager. And that was just I'll let Councilmember Risto talk about it as well, but what an incredibly impressive feat that our local community college has achieved. West Valley College, from my understanding, is the first community college in the country to guarantee a meal for students enrolled in 6 units or more at the college. And not only it was, I attended a nice public university, but my meals at Cal Poly were not very good, putting it generously. That was high quality food for some really engaged students. So very impressed with that. I attended the first meeting of this cohort of the Los Gatos Youth Commission, which I really enjoyed. We have a super, super bright, super engaged group of students. This was, I've seen the last few years of these meetings, and this was the first year that I had seen where there were nominations, multiple nominations for every position. Lots of students wanted to be chair, lots of students wanted to be vice chair. They were just super, super engaged, and I give a huge amount of credit to the chief for her work stewarding that group of students forward. I enjoyed attending an event at Beyond Text, our local bookstore in Los Gatos, with some other people in the community. I attended the Los Gatos Finance Commission, attended the West Valley Sanitation District, which just as a quick update on that, the West Valley Sanitation District is now fully engaged in our recruitment process for our new CEO or our new district manager and engineer. We are using the same firm that we used in Los Gatos to find our very high quality town manager. So wish us luck. If it's a very niche position, it's a very hard position to recruit for. So if anyone happens to know anyone that is qualified to run a small sanitation district in Santa Clara County, let me know. And the last announcement that is very much a personal announcement, but I got engaged over the weekend. That's thought was worth sharing.
Oh, congratulations from all of us. And I think you had another item that you wanted to discuss in council matters as well.
Oh, yeah, sorry. I thought did you say we were going to go through all? Do you want to do that now?
Yeah, we'll just go down the line.
Got it.
So.
Sure. So this is something that my apologies, it would have been more brief. Councilmember Risto and I requested a discussion for the full council on the topic of e-bike, e-motorcycle safety. This is something that has been very much an emerging issue in our community. A lot of communities around California are facing this, especially communities that are a bit more affluent like Los Gatos. I really appreciate Mayor Hudes, you putting this on the agenda so quickly and allowing for this discussion. And so I'll just say, I think that Councilmember Risto and I have put together a proposal. I would like to have staff take a look at that and bring back a report on what could be done in that space to make a difference on e-bike and e-motorcycle safety. The 4 proposals that we put in, I think are, I think we really tried to balance not using a whole lot of town resources, but making a big impact on traffic safety. Obviously, you could hire 12, a dozen more police officers and hire them all for e-bike crackdown, but we don't have the capacity to do that. And so looking at those sort of these 4 key recommendations that are outlined in the proposal that's the very end of the agenda on education, specifically a buyer's guide targeted at parents, a registration program in partnership with the high school. We've started some of those conversations with folks at the high school, but I think a coordinated response is very important. Supporting some key pieces of legislation and working on figuring out how to most effectively work on enforcement. And so that is the proposal. And so process-wise, do we just need one other council member to say, yes, bring this back?
That's my understanding of our current process, but it's available for discussion by the full council. So if anyone else has questions, yes, Councilmember Isto.
Right. I don't have any questions. I wanted to just add in, as the Vice Mayor outlined this, I mean, in terms of the education, I've already met with the managers of the 3 bike shops in Los Gatos who only sell legal e-bikes. They do not sell the illegal motorcycles. They would be happy to work on putting together maybe a buyer's guide, the idea being that before parents go out and buy something street illegal for their kids, either for Christmas or for sure next spring before the next school year, that something like that could be rolled out. I think there's a variety of things here that can be done outside of our staff. And I know Safe Routes to School, Wendy Riggs is very interested in looking at, trying to coordinate registration of bikes at the high school and at Union Middle School. That would take the work of our police department. So I don't know what kind of resources we're looking at. But if students can't park those bikes at school, parents are less likely to be buying them for them. I know, for example, Union Middle School right nearby at the very beginning banned e-bikes, all e-bikes, which, has created some consternation for people that had Class 1 e-bikes that don't go over 20 miles an hour and are pedal assist, but at least they have the much easier job of deciding if they want to allow them at all. We're going to have to claw back having kids ride street illegal bikes. But I think there's a lot of good that can come out of this. I don't walk through town a single day without having at least one resident stop and talk to me about e-bikes, e-motorcycles. It's, just today in Chicago suburbs, a kid was killed on an e-bike, as the article referred to it, but the kid was going like 40 miles an hour when he slammed into the back of a pickup truck. So I think a lot of this is education, and I think this is really incumbent on our town to take a stand and make an effort to rein this in, and it feels like there's very easy ways to do that.
So if I may, I had a question about this. So the next step would be for staff to prepare a report. So is it the proposal that staff would address the 4-pronged approach, including creation of a buyer's guide, creation of a registration program, supporting legislation, and matters for enforcement? That's the intention?
In my opinion, it would be staff taking a look at these 4 things that the Vice Mayor and I have worked through and outlined, and giving a report back on what's feasible, what's possible, what it would take. And if it came forward as a discussion item, an agendized item, then the council could either vote on parts of it, or we could hear from town staff what they could do and what is under their purview and what would have to be done separately.
Okay, thank you.
Agreed. Sorry, go ahead.
No, I was going to ask who on staff would be primarily producing that report, and then I have some questions about that.
It would be the police department, but I want to just clarify the process. If council wants staff to exercise any amount more than a de minimis amount of work, it will need 3 of the council members to do that. Otherwise, you're looking at putting this on the next agenda as an informational discussion without a whole lot of research and support. I just want to make sure we're aware how much level of depth do you want staff going into that.
Well, I would respectfully disagree that our current process, I'll read it, regarding the agenda, that the agenda is prepared by staff in consultation with the mayor for the mayor's final approval, and then items proposed to be added to the agenda requires the mayor's agreement to be added for action. If the mayor does not agree, the item shall be listed on the agenda for discussion purposes only under council matters section of the agenda, which is where I think we are tonight. Council may then discuss whether to place the item on a future agenda for action. 2 or more council members of the council must vote in favor of placing an item on a future agenda for action. The mayor, in good faith, will make every effort to place the item on the first available council agenda in consultation with the town manager. So I don't believe that it requires a majority of the council to do that. It requires 2 under our current procedure.
I think there's a slight distinction between putting it on the agenda for future discussion and then directing staff work. And so I read the policy to provide that 2 council members can vote to put it on the future agenda. But I do think a majority would be required to direct staff to work on the proposal.
Could you maybe cite the source for that?
Yes, I'll pull up the policy, and it looks like there might be other questions in the meantime.
I was just going to say, I think, the point might be moot. I think I'd be curious to hear if there's interest in doing this. And I would just say, I'm in total agreement with what Councilmember Risto said. My intention was not to have staff go do all of these things that we suggested. It was to have staff report back on what could be done. Also, if there are other suggestions, and also to understand kind of what the current approach was. I've learned a lot from our police chief in particular about, A, the good work that's already being done, but B, the massive limitations that are just inherent in state law and, not wanting to injure, teen boys running away from police cars. So I think there's a lot for the community and council to be educated on. So both responding to what's in the proposal, but also just an update on this topic to the council.
Okay, thank you. I'd like to maybe follow up my question then, if you don't mind, to the police chief. With regard to the recommendation, does the police department have the resources to prepare a report that would create a buyer's guide to put forward a registration program and to support legislation and to come up with taking legislative action to align an e-bike ordinance with the town's social host ordinance? Those were the recommendations in summary.
Thank you for the question. I definitely recognize the concern from the community, and I hear the concern from the council, as we have been addressing since the beginning of the school year, and in a heavy manner for enforcement and education as prevention as well. We've been doing a lot of this through the Voice of Our Youth Commission over the past couple of years. There is limitations surrounding some of the enforcement approach and abilities, as the Vice Mayor had even mentioned. I think for all the items that you had just mentioned, that is a pretty significant lift for the police department. We are underway with our school resource officer, who is one individual overseeing quite a few of the schools and collaborating with them and some of the approach on campus from education, and even today that we're working on several matters. We have directed enforcement each morning out there at the schools to try and curb some of these efforts. is there more that can be done? Yes, I do believe that there's more that can be done. From a legislative standpoint, this year there's 875 that passed, and that was part of my involvement with Cal Chiefs to bring forward that, and it's on the governor's desk currently waiting signing. All of that said, to achieve everything that's on that list, I think that that is going to be a very heavy lift with our lean structure currently. Again, going back to the one school resource officer that's really spearheading this. If there's another recommendation on how to achieve that, or if the council is interested in an update potentially through the Friday email on where we are currently at and what we are doing, and then to take a look at that and maybe provide further guidance, that might be another option. I want to at least provide the information of where we are currently at, what we're currently doing, and then maybe take a look at it from there.
Thank you. Vice Mayor?
Thank you. So again, what I'm interested in is hearing a analysis from staff on these different ideas. The buyer's guide, in my opinion, should not be a huge lift. That's a online and paper resource. The registration program, I agree completely, is a heavy lift. But from my engagement so far with the schools, they have an interest in that, and so I starting those conversations, I think, would be well worth the effort. And then enforcement, I actually see the suggested enforcement recommendation in the proposal is actually, in my opinion, something that would be for the town attorney. And so, again, I'm not thinking that we need to do all of these things right now. I would like this to come back to council with a report talking about what can be done.
Councilmember Risto.
Yeah, thank you. And in fact, if the town can't put together a buyer's guide, I can work with the 3 bike shop managers and they can do it. So that would be something else. I think what I'd be interested in is, of those 4 things, maybe a general opinion of which would it be considered effective and helpful to the police department, and furthermore, what it would take to do a registration program in cooperation with the schools. Would that be something that would take a year or 2 years or something, just information along that, not, gee, at the next meeting, roll out the registration program. And then, yeah, for the enforcement part, like the social host ordinance, that seems more of the town attorney's work. So we might bifurcate that question.
Thank you for that information. I'll take it first from the educational approach. So we are currently underway in working with our school resource officer and the schools to be able to produce some curriculums, more of a pamphlet of information. So it's not necessarily a buyer's guide, because we don't necessarily want to direct what items, but what is legal, what is not legal, and what are the parameters that go with that. So we are working on updating that material. I'm supposed to be actually reviewing a draft tomorrow. So we hope to have some of that information out next week. There is collaboration with Wendy Riggs from Safe Routes to School for the bike rodeos and other information that goes to the schools. So I know this is a very active conversation with the schools. There has been material sent to the parents through the school system, so that collaboration will continue, because we want to make sure that there's that engagement there from the school system. Going over to the ordinance, yes, the ordinance, I think there's potentially opportunities that might be there. I'm familiar with the Marin model, and that might be something that we could potentially take a look at. I don't want to speak prematurely on that level.
And then to continue on, what about the one that actually is most key to me is the registration, so that students cannot be parking street illegal motorcycles at schools. And so if there's a way to prevent kids from being able to park their illegal e-cycles at schools, then maybe the parents won't continue to buy them.
I think that's going to be a question that we have to also engage with the schools on, because that's state property. So in order for any action to be taken there, we're going to have to definitely engage with the superintendents and the schools in that manner. So I can't give a direct answer on that without having the other stakeholders weigh in on that. From a registration system throughout the town, we would have to assess the mechanism for that. And I think of that similar to like employee parking, the lift that went with that. And so I just don't necessarily have a process in mind for it, not to say that it potentially couldn't be explored.
Okay, thank you. And I don't know that we were thinking about global registration, just the schools would have to be in charge of it. If a kid's going to ride something illegal on the street, the police will just have to deal with that. But the schools saying the bike cages don't allow bikes that aren't registered with the school or through the police or something.
I know that they have done some enforcement action related to that, where actually they directed them back to the CHP website where there is some curriculum there that they have to take and pass, so it becomes informative and educational in that approach. But in terms of the other actions that are being taken, I don't have that information currently in terms of the school specifically within their scope.
So just a comment, I think this is a very important topic. I think it relates to the safety of our young people who are doing dangerous things on the streets. And I think that the council should do something in this area. I'm concerned about the step of an agenda item asking the police department to prepare a report on those 4 areas, particularly since one of them, the most important one, as Councilmember Risto says, the registration is really something of the school district and the schools. And so I also think that these are steps that are important, but I think there's an even more important step in how do we get people to use e-bikes? How do we make our streets safer? What do we need to do in order to encourage the use of e-bikes? And that's not one of the 4 recommendations. And so I feel that this is maybe not ready for a council agenda with a report, but more for a study session, perhaps with the school district members. And I know, Vice Mayor, that you've held some open study sessions as well, but I think something happens when the town does the noticing as well. So for me, I think that would be a more logical next step than putting this on the agenda. That would require significant lift, as the chief says, in order to develop a report on these items. So anyway, that's kind of what I'm thinking about. I don't know if there's any reaction to that. Okay. Vice Mayor?
Yeah, I guess I don't know from a staff perspective if it is going to take a whole lot less work to do a study session. I guess maybe that's a question for staff. Is that less work?
The question isn't how much work, it's your desire. If you want us to do that, we'll spend 100 hours on the topic. I think the concern really goes to 2 members of the council are desiring something. Agendizing an action, we can do that with limited work, depending on the scope of what you're asking for. But if you're asking us to look into this and it potentially has dozens of hours of work and impacts a priority in the police department, shouldn't it be the majority of the council directing that a level of work? So it just really comes down to what you're looking for.
I agree with that. I agree with you on that.
And so if you want us to do a cursory look at these 4 items, we can do a cursory look, but we may not necessarily be able to dig deep without additional effort.
Yeah, I think that's totally reasonable.
Thank you, Mayor. So I'll just add in, I do think we need to spend some effort on this. It's clearly a problem I hear about also. I mean, the members of our town are telling us, we need to do something here. Lots of them are doing. So I don't know how much work. I mean, there may be different levels of it. So you mentioned a cursory look sounds like, you know, the best way to go. I mean, I think you talked about we'll agendize to talk about how much resource do we really want to spend, and maybe we do need to go that way, because it sounds like this is a lot of resource, and I'm not sure I'm willing to say, you know, spend 1,000 hours. Maybe only 200 hours is enough. I don't know, because we haven't done any cursory work on it, but I'll just add my voice that yes, I think we should do some work on this. I don't know what level of and which choices are the right place to spend the lots and lots of hours at this point.
No, that's really good. Well, if there's a majority of the council that are identifying this as a priority, absolutely. Let us look into it, spend some level of effort, and if it looks like something here is taking us down, it will be a tremendous impact, we'll come back to council and advise the council on that matter of what it would take to actually get there, so that at least we can do some movement. I mean, the educational buyer's guide may not necessarily be that much effort to ascertain how do you develop that, not necessarily that we're developing it and coming and bringing it to you. So that's, we can do that on that topic, but on a registration program and that may require legal analysis to determine the extent to which we can implement a registration program, coordinating with the schools and whatnot. We may dig to some degree, but not necessarily really deep until we figure out how much time it's going to take us.
Vice Mayor.
Yeah, for the manager, I think that's perfect. And I think, you know, I think what's important, and being that, you know, seems as though we have a majority of the council that's interested in this, I think what I would like to empower staff to do is, you know, I've had conversations with school board members and you know, the superintendents about this, but I'm just me, right? Like I'm just one council member having that conversation, talking about, you know, ideas and what might work, and you know, it's easy to say, oh, sounds like a great idea, right? And so I think what would make sense from, you know, this sort of cursory take on this at this point is staff engaging in a formal way with our partners at the school districts and understanding what would be involved in this, what level of interest do they have in this, and then coming back to the council and giving us direction from your expertise on, you know, yes, if we really want to, you know, maybe the registration program's a total non-starter and it's just going to take a ton of resources and nobody's very interested, that'd be helpful for us to know. On the other hand, if the schools see this as much of an issue as I think they might, I think the schools would be interested in putting some of their own time and resources into it. So I think getting that understanding, coming back to us, helping guide us on next steps to make an impact.
No, I think we can definitely accomplish that.
Thank you.
So I appreciate that town staff is able and willing to help support something that's a priority for our community. I would just have some reservations that I want to express, that things like a buyer's guide, to do that objectively requires real resources. Those models, those brand names change every year. I think the top 3 brands in California are not even listed in the example. So I don't want to underestimate this. The registration program, I think, is substantial. I think in a sense we're sort of creating a DMV here with registration and legislation and enforcement. And I just want to be careful not to, for residents not to get the impression that we are able to go to the extent. This looks like excellent legislation at the state level, but I think when it comes down to it, some of the things that we can do here can be really effective in the area of education, communication, and like I mentioned before, encouraging people to use e-bikes and helping them to understand how to do that safely. So there's definitely things that we can do here, but I really am concerned about leaving residents with the opinion that we're able to set up a lot of what's been described in here. And so I just, given the resources that we've just heard about that are necessary for wildfire protection, I'm concerned that this, in its form, would leave the impression that we're going to do something that is way beyond what Los Gatos can do. Maybe Marin County was able to do some of this. They're probably 50 times our size with 50 times our budget. Certainly, there should be legislation moving forward in the state of California on some of these very items that are, listed here, and I think we should try to support that. But I think we have to be careful about leaving the impression that we're going to solve this problem with, a four-pronged approach that is beyond what I think is within the means of the town to achieve. Councilmember Badami.
I'm also concerned about the heavy lift to the police department, to our staff. I do see it as being an issue. I'm downtown along with Councilmember Risto, and these teenagers go wild on those e-bikes. But I see it more of a parental issue with their children than us being kind of overreaching with what parents should be doing with their teenagers in a family setting in regards to public safety in the community.
Vice Mayor.
It sounds like we will agendize a future discussion about this, so I don't need to, get into this all that much right now. But I'm a little bit surprised to hear that perspective. We just had a long conversation about public safety, and I'll share a personal example. I was 2 weeks ago walking at dusk on Los Gatos. I was crossing Los Gatos Boulevard, and at the intersection of Los Gatos Boulevard and Los Gatos Almaden, and I had a walk sign. Walk sign says go. So I look both ways, start to go with my partner, Kylie. And had I not noticed that pair of kids on a Suron doing at least 40 miles an hour, maybe 50 miles an hour, were speeding down with no headlight and grabbed Kylie and pulled her out of the way, she would have been hit. And that is a parental issue, that those kids should absolutely not be riding those, and it is hugely on the parents. But that then impacts me, who had no decision there. I had no influence on that parent's decision. And so I think it is a huge public safety issue. There have been numerous fatalities. And so I really feel that we have an obligation as a municipality to support the public safety of our residents. And I think this is a very clear way to prevent avoidable tragedies. And so I'm surprised to hear when we're talking about public safety that this is not somewhere that we should be investing time and resources.
Councilmember Risto.
Two quick things. One, I don't think we want to be the DMV, but what I think about is when students at Los Gatos High School want a parking permit, somebody walks out to their car, takes a look at their car, registers the license plate, and gets them the parking permit. The high school and the middle school could potentially have parking permits for bicycles. And if the bicycle is not street legal, it can't have a permit. That's simple. That's not somebody taking a test. That's not going through a bunch of registration. That's not even a safety training class. It's that thing goes 50 miles an hour, that doesn't get a permit. And that's pretty easy to do. The other thing is, in terms of parental education, it is amazing to me how clueless a lot of parents are. I mean, some of them don't know what they're buying for their kids are street illegal. Some of them are looking for that. I talk to the managers at Mike's Bikes and Specialized and Summit. None of them sell e-bikes that can go over 20 miles an hour, except for class 3, which can go 28 with pedal, and you have to be 16 or older to get that. And they have parents coming in demanding bikes that go 40 miles an hour. And when they're told, and every manager told me they dealt with this, maybe it was the same parent, when they were told that they don't do that, and your kid can go on something that goes 20 miles an hour, the parent was like, well, that's ridiculous. So they probably go and buy something online. I think we need to get that education out there that that's not an e-bike and that's not legal. And so I think, the buyer's guide can be done by the bike shops. And, I think the other thing is, they're on board with that. That in fact, 2 of the bike shops, I didn't get to ask the other one, would be interested in offering evening safety classes for kids. So they would just do that on their own. I know we have bike rodeos. I know that we have part of the PE program at Fisher Middle School in 6th grade is bike safety. I know that I had helped with bike safety skills, but for people buying e-bikes specifically, if they're at the shops, they can only buy bikes that are legal and they can get the safety rules. So I just think there's a lot that can be done, and it can be community oriented and it can be simple.
Yeah, I believe there's a lot that can be done, and the registration program, I would think, would have to be led by the schools, not by the town. And we could collaborate and encourage, and that's why perhaps a study session in which we include the school districts might be a way to do that. It would be difficult to force them to attend an agenda item with a report and have them take action and for us to vote on it. I also think that the education is something that, the bike shops and the parents and, the school resources and the police department can help with. I definitely think there are things that we can do. There's more that we can do and we need to do. I was just concerned about trying to codify these 4 items with the resources that we have. So I don't know if we're going anywhere with this, but it sounds like we are going to have an agenda item. Yes, Councilmember Rennie.
Maybe you're bringing up a good point. I was trying to understand why we seem to be a 3-2 that working on child safety was important. But if the issue is you don't necessarily like those 4 items, I'm guessing the 2 that brought it just did their best to come up with ideas, and they'd be open to other ideas if staff had other ideas. I appreciate you working on trying to solve the problem, and if some of those 4 don't work, I suspect you'll be okay, and maybe staff will have other ideas. Maybe other ideas will come up in a study session. So if that's an issue, maybe don't be so set on these 4 items, but set on the idea of child safety with e-bikes.
Yeah,
Vice Mayor.
Absolutely. I think these are 4, ideas that we have on sort of lower resource ways that don't necessarily cost a lot of money to make an impact, understanding the complications around enforcement, et cetera. But totally open to all ideas. No bad ideas in a brainstorm. All in for exploring the myriad of possibilities for how to address this issue. I just think there's a lot, like the mayor just said, there's a lot more that we could do, and so I want to do more.
Yeah, that makes sense. And I do think that there's actually a lot in here that could and should be done at the state level as well. And so it'd be interesting to track what bills are going through that are addressing e-bike safety, registration, penalties for people using illegal bikes, and things like that, because that does seem to be part of maybe the solution. It just seems to be more part of the state part of the equation. So, okay, town manager.
If I may, because I I need to make sure I'm clear. If a majority of the council desires us to look into this deeper, we can do that. And we can come back, and where we can reasonably go into some depth, we can go into that some depth. Depending on the scope of what we're looking at, and this is an important priority, clearly, by the discussions the council's having, the other consideration the council needs to have is, you've already defined your strategic priorities for the town, with 3 of them being a priority where we've been spending a tremendous amount of effort. In looking at those, this does not fall in one of those strategic priorities. So the question, as we're looking at what are we looking in the future, what level of effort may necessitate the council deciding on which priority do you want to remove from the list to replace it with this one? Because we do not have the capacity to add another one. And I'll just, when I think about Public Works and the police department, I think we're already engaging the school district on businesses' concerns around parking around the campus and how do we mitigate that aspect of it. So now we also have e-bikes. We're dealing with traffic safety. And we're doing a tremendous amount on one of your 3 top priorities of financial management and wildfire risk and dealing with housing element and development. We don't necessarily have the capacity. So when I asked the question about how deep and it really remains to be seen the level of effort that's going to be necessary. And while some of these may seem easy, I've experienced asking staff in another governmental agency to do something from an elected official position, thinking it wasn't a big deal. They did the work only to realize that it was 40 and 60 hours what I asked, and had I known that amount of time, I would have told them don't do it. And so I just want to make sure we're mindful that that's what our strategic priorities are for, and that we may need to grapple with that piece too.
I'm wondering if there's a way to maybe bound this with a number of hours that we're asking our police department to put into this. Is that?
I just need to know that there's a majority that want us to do some level of work, and let me gauge the balance of doing enough meaningful work and then coming back and talking about how far deeper do we want to go.
I'll make a motion to instruct staff to come to do some level of work on addressing e-bike and e-motorcycle safety in the town of Los Gatos, and to come back to the town council with a report on that item.
I'll second it.
Okay. Motion and a second. Is there a time frame for this?
I think, how long do you think you need?
I will look to the professional on this one.
I would like the opportunity to speak to some of the stakeholders on this, because I certainly don't want to speak on their behalf. So if you would give me maybe a month, and
yeah, I was
that
like,
will
maybe
be absolutely plenty of time. I just want to make sure that we can work within our community stakeholder.
Yeah, let's do within 2 months in case, whatever. But yeah, I think that's a perfectly reasonable time frame.
It's definitely an important priority. I absolutely agree with that, in exploring some of those options. I just don't want to commit to something without doing a little bit of further research.
Great. Thank you very much.
Councilmember Rennie.
Yeah, since there seemed to be so much sensitivity on this, I want to make sure I understand. We said some level of work. I think I would call that scoping work, which requires you to do some level of work to scope things, understand how much work they're going to be. Is that what we're really saying, is scoping work?
No, there would be a little more in that in terms of if we're looking at legislation, maybe looking into some of the legislation that's out there instead of just considering, do we want to look at legislation? It isn't necessarily going to mean look at the full gamut of e-bike safety, the 4 items that are here plus everything else, and come to us with some more cohesive plan. It wouldn't mean that level of review. I think I'm asking for some leeway. Thank you for the 2 months. That's very helpful. Some leeway to say it is a council priority. A majority of us are okay dedicating staff time on this one and taking it away from something else, but don't necessarily spend so much time as to impact other priorities before you come back to us to say, yes, we want to swap out these priorities and go full bore in that area.
Yeah, I'm in agreement with that statement. I'm not sure I'm ready to take any other priorities off the table, but I'd like to have some work done on this.
Yes.
If I may, through the mayor, I'd also like to add that AB 875, if signed by the governor, that will put into effect, because it's passed all the other processes as of last week, that will allow us 3 different code sections that did not exist previously to be able to actually tow e-bikes. And that is a tool that we did not have prior to this. So we're waiting for that to go into effect. So there is, I guess I'm trying to offer some glimmer. There is going to be some legislation that is coming. We're just waiting for that signature to get into place. And then we will work with the process of what that will mean. And we will have the ability to remove those devices from whomever it is. And there's actually an educational component within that bill as well, in order to get that e-bike released.
Okay, so I'm okay with supporting the work as long as we don't pass the threshold of impacting another priority. That's my understanding of what's been proposed. So I guess we do need to. We have a motion and a second. Is there any further discussion? Okay, I'll call the question. All in favor?
Aye.
Opposed? None? Okay, passes unanimously. Thank you. So that brings us to the end of our normal agenda.
And I think you still technically have a couple council matters.
Yes.
Sorry.
Yeah, correct. So let's continue going down the line on council matters.
I'll try to be brief. I think they went to all the council members, but I met with representatives from Eden and Grosvenor to hear about their challenges for housing sequencing with how to sequence the affordable housing with the Four Market in North 40 Phase 2. As the vice mayor mentioned, there was a ribbon cutting for West Valley College new campus dining. And I think what's really significant is that they talked about how there was outreach to the students asking, like, what are some of their biggest barriers to education? And the number one thing that came back across the board was food. A lot of students there are struggling financially, and food insecurity is a real thing. And they partnered with a really great food provider. And as the vice mayor mentioned, anyone taking 6 credit hours or more, they can get 3 free meals a week. And then students who demonstrate great financial need can get 6 meals a week. And so this will make a real difference. I think after the pandemic, West Valley went to free parking, they've gone to free tuition, and now there's free food. So we do have a population that is financially strapped, and this makes a big difference. Then let me see. Oh, on the 10th, our council member Rennie was not available, so as an alternate, I stood in at the Silicon Valley Clean Energy Board of Directors meeting, and I'll just give the summary. Basically, the staff shared Silicon Valley Clean Energy had begun issuing $33 million in one-time bill credits to all customers in September. So everybody who's got Silicon Valley Clean Energy as their energy provider is already paying lower monthly rates, and now residents will basically receive a credit of about $50, which is about 24% of the average monthly energy bill. So the kind of the mission of Silicon Valley Clean Energy, besides decarbonizing our electricity, is also to provide low rates and do as much for the customers as possible. We also approved the fiscal year 2025-26 operational budget, and we previewed the 2026 integrated decarbonization roadmap. I won't go into all that. You can look at the website. The next day I had the VTA Policy Advisory Committee meeting, and of a couple of the items we did, the one that might be the most of note that might affect Los Gatos is we approved the 2026 State Transportation Improvement Plan and allocated $69 million in STIP funding to 3 different projects. So there was some funding that was left over from a project that couldn't move forward, and so that was allocated to other projects in addition to the extra money we had. And the the selection of projects was the Diridon Station, Bascom Complete Streets, and Homestead Safe Routes to School. And one of the other projects that had been considered, there were a couple others, was the Los Gatos Highway 17 bike pedestrian overcrossing. And we decided to approve the Bascom Complete Streets primarily because that, let me see if I can get this right. Got that here. The idea was to make sure that projects that were already moving forward and had, that project has a large amount of money that was granted to it that would expire in 2027 if it didn't get the rest of the funding. And so we didn't want to put $30 million at risk by not completing the funding, whereas I could have argued for the Highway 17 bike and pedestrian overcrossing, but the amount of money available wouldn't get us over the finish line, and the money that we've got is not at risk. And VTA, and I know our town staff, are working hard to look for other sources of funding. But it was an idea that we didn't want to see other grant money go away. On the 14th, I attended Oktoberfest, which was KCAT's fundraiser, which was a lot of fun. And, you know, as we're sitting here being televised by KCAT, it was great to see them put on a great party and raise money. And then finally today, I did a catch-up meeting with Jen Lin from the Chamber of Commerce, got an update on what went well, how really well Taste of Los Gatos went from a variety of perspectives, and what the Chamber's plans are going forward. And that's it. Thank you.
Councilmember Badami.
Thank you. I participated in a board meeting of the West Valley Stormwater Authority, and with their new name, they've released a video on their website titled Understanding Stormwater in West Valley. And it was really well done. I just encourage everyone to take a look. On September 4th, later that same day, actually, I participated in a board meeting of the West Valley Solid Waste Management Authority. And on September 6th, while working downtown, I briefly attended the Taste of Los Gatos. It was festive, well attended, but I'm very fortunate that I work downtown, and I'm lucky that I get to experience a Taste of Los Gatos every day. That's all I have.
Okay, thank you. Been a busy couple of weeks. I participated in District 5 Mayor's Call with Supervisor Margaret Abe-Koga, and got some of the information that we had today, but it was interesting to hear sort of the political perspective on solving some of the issues, and I appreciate that she held that call. I participated in the Taste of Los Gatos and got to hand out the Golden Spoon Award to 2 different restaurants that were voted by other members of the chamber, I believe, for their excellence, and that was a lot of fun, and got to see how many people, there were so many people from outside of Los Gatos who came to that event. And I'll jump to just this past weekend to the Oktoberfest, where I had the honor of tapping the keg with a wooden mallet and spraying beer all over, and had assistance from Tyler Taylor in doing that. It was early in the day. It was a wonderful event. I came back after 6, and the party was still going, and people were enjoying themselves, and I think behaving themselves as well. So it was a really fun event. And again, many of the people were from outside. I think they were kind of searching, and they said, oh, there's an Oktoberfest, and it's happening in September. So we got quite a few folks at that event. I participated in a community center leadership meeting on the 8th of September, and then the Finance Commission had their regular meeting that day. I met with a group, a real estate group, Christie's Sereno, which is on Los Gatos Saratoga Road, and I learned that they have 140 agents working out of that office. It's a very sizable office, and they were very concerned with some of the same issues that all of our residents are, and it was a very good discussion with them. I participated in a meeting with the town manager and the Chamber of Commerce, understood their debrief on their event and their ideas going forward. Then on the 11th, I participated in the Cities Association Board of Directors meeting. And again, what a terrific group that's focused on issues of common concern. There was a very good presentation about suicide prevention, and with a lot of very valuable information that we should all know about. And so that pretty much brings me to today, so that's it. Thanks. So let's go to town manager matters.
Thank you, Mr. Mayor. The council covered most of the activity. I just want to highlight the West Valley College. It is phenomenal to see a district that I grew up in and served on their board of directors and was part of the reason for the formation of their scholarship endowment fund using land revenue proceeds, to see them grow into what they're doing today. It truly is going to make an impact. And most importantly, it's encouraging more of our residents who are going to other community colleges outside of our jurisdictional boundaries to come back and go to West Valley because of the benefits that we provide. That's another sign of what a wonderful region and community and town that we actually are. With that, I'll turn it back to you, Mr. Mayor.
Okay, thank you. Town attorney.
Thank you. I wanted to report that the Town Council met earlier this evening in closed session to conduct a conference with its labor negotiators pursuant to Government Code Section 54957.6, and that there's no reportable action.
Okay, thank you. That brings us to the end of our agenda. We didn't have any items that were pulled. So with that, this meeting is adjourned.